for me. I've got 6 amalgams and I'm getting them replaced on Tuesday, or taken out on Tuesday, and I didn't want to have an anaesthetic, and the dentist has sort of said that I really have to have one. I mean, none of them are root canals. I mean, what's your opinion of anaesthetic generally?
The anesthetic is more for the dentist than for you, because they're afraid of hurting you. But the other thing about that is that on our program, the enzymes and minerals pull out all the toxins. So what you could do is have the anesthetic, and then gradually on the program, the anesthetic will come out of your body. During the point holding, we've had several times where the points were being held, and you could just smell the anesthetic coming out of the person's body.
Right. So you think it's okay if I insist with the dentist that I don't want an anaesthetic? Am I right?
Okay. Now, I might add that for people who go beyond body electronics and go into cranial electronics, they go back through and re-experience as if they never had any Novocaine whatsoever, and re-experience that tooth being dug out, hammered out, chiseled out, and with all of the pain that had been originally suppressed by the anesthetic. And so all of these things that were suppressed by the Novocaine and so on, or by general anesthesia, the person will re-experience again with full memory as the anesthesia, which has blocked the tissues, comes out. So there's no way escaping that. Now, one of the greatest problems for eye, ears, nose, and throat problems will be trauma to the teeth, especially in dental extractions. And so oftentimes people who have problems in any of those areas, they'll find out their problems began with a dental extraction, which had been suppressed, and therefore by reflex action the body suffers. Ruth.
I didn't have any root canals. I was already on the program when I decided to have my amalgams out, and I was very frightened about it because of the pain involved. For the first one I had an anaesthetic, and I could feel the anaesthetic for the next 2 weeks in my mouth. So I chose to go without anaesthetic after that, and I was surprised at how I could handle the pain, particularly with the training that body electronics gives you to lovingly and willingly endure. It was much better without.
Lil.
I had mine done yesterday without an injection, and the dentist said to me a couple of times, do you want an injection? And I said, oh no, it's okay, and I was sweating a bit, but yeah, the point holding certainly does prepare you to lovingly and willingly accept the pain, and it wasn't really nearly as bad as I expected it would be. So, you know, give it a go, and halfway through, if it's too much, you can always choose to have an injection then, but you might be surprised that it's not really as bad as you thought.
I also had my crowns removed and redone without anaesthetic. That was okay too.
I pulled out my own tooth here recently just to see if I could do it and if I could handle the pain. The pain was there, but I was able to pull out my own tooth, and that, which I might add had a root canal on it. And I had an x-ray of it. I didn't get the bottom part, so all that has to be scraped out. But you'll find that your ability to endure pain will increase to the point where any type of dental activity really isn't that bad after we release so much trauma from our bodies.
On the other side of the fence, I found that because it was so traumatic for me to have my fillings out and the root canals and all this work done, and I had it done in 2 sessions, 2 3-hour sessions, I had all this done. I found to take the Novocaine, and then it took me 2 months, actually, of pain, where I could feel all the pain, and I went through all the memories of him pulling the teeth and everything. I found it more comfortable to experience the pain without his fingers in my mouth and without all that stuff in my mouth on my own. But I think it's up to an individual which way you want to do it. Have the pain right there with the dentist, or have the pain later Of course, if you're doing the program, you'll re-experience all the pain and go through it then. I found it more comfortable that way, but I guess it's an individual thing.
I hope you're ready for this. Now, we have some of the dentists are reporting back to us that when they pull out a terribly, I'll use the word infected root canal that has made a big abscess down in the bone, that oftentimes there has been a release from the body at that time, from the hole in the aura caused by the suppressed anesthetic and the pain from the root canal and so on, that there is a release of these entities which have come out of the individual and have knocked the dentist backward to where they fell down at that point in time. And then that entity leaving the body has really come out right through the dentist who's pulling that out, and they're simply knocked over by the energy that's there as that entity is being released. Tape? Okay. Now, if any of you do not believe in entities that are locked into the human body, we'll discuss that a little bit later. But suffice it to say for now that there are some people who are terribly ill because of the presence. Pardon me? What happened? Oh, okay. But there's tremendous problems here with entity involvement directly related to the anesthetic and the pain, which is incorporated into tooth extractions and that sort of thing. Anywhere that you have unbearable pain to the body or any type of anesthesia to the body in any form will cause pretty large holes in the auric field that can be detected with Kirlian photography and can be detected where people are extremely sensitive. And they can detect these holes in the aura, especially those people who can see auras. And these people who can see auras, and there's quite a number of them around more and more as people are becoming more sensitive, you can see the holes in the auric field where you do have these energy overlays on the physical body which are entity related. And just because you cannot see an aura around a person doesn't mean that they do not exist. I just want to make that clear to you. And some people are capable of detecting and seeing these entities because of their the gift that they have to see these things. Some people, they can just see them and have been able to see them since birth and they don't understand their gift. But it's a very clear perception for some people who have that gift. And some people have that gift that they've inherited right down through their lineage, right down through their family tree. Doug.
If you go back to the root canals, the dentist that you might want to all be familiar with is a man by the name of Dr. Weston Price. He was an American dentist who was very well known back in the teens and 20s and 30s. And he originally got interested in root canals because he gave one to one of his own children, a son, and then his son died of a heart attack just a couple of days after the root canal. And this got Dr. Price quite curious about the effects of root canals, and so he started to do a lot of studies on root canals. I believe this was probably back in the teens or 20s. And one of the studies that he did was he found that if you took a healthy tooth, like a living tooth that had been extracted from somebody's mouth, you could take that living or healthy tooth and you could surgically implant it under the skin of a rabbit, and what would happen is the rabbit would just form a small cyst around the tooth and then, be fine. It wouldn't really damage the rabbit. The rabbit would live out its life and be reasonably healthy and all that. But he found if you took a tooth that had had a root canal performed on it previously, and you took that tooth and put it under the skin of a rabbit, it would kill the rabbit quite rapidly, and not only would the rabbit die, it would also develop most of the same symptoms as whatever person the tooth had come from. Like if the person had arthritis, and it was their root canal tooth that you put under the skin of a rabbit, the rabbit would end up with arthritis, or if it was heart problems, or whatever the particular problems of the original person who'd had the tooth, the rabbit would develop that. You could then take that, after the rabbit died, you could take that tooth out and put it under the skin of another rabbit, and you get the same results. And apparently from one tooth, you could kill about 200 rabbits. So there was enough toxicity in one root canal tooth to do away with 200 rabbits. And if you took even just a small little fragment of a root canal tooth and did the same thing, put it under the skin of a rabbit, it would still kill the rabbit. The only difference would be it would take a little bit longer than it would if you had the whole tooth. And what Dr. Price, and this top book there, The Price of Root Canals, this is a compilation by Hal Huggins, who's an American dentist who's living today. And basically what he's done is he's taken a bunch of different articles and lectures and things that Dr. Price did back in his day and put them together in a book form. And I understand that Huggins has also been replicating a lot of Price's experiments. This other book here, Dr. George Meinig is the author, and he was actually a dentist who throughout most of his professional life did root canals. He was actually one of the founders of the American Endodontic Association, which are the dentists that do root canals. And in his retirement, he happened to be browsing through the library at what they call the Price-Pottinger Foundation, and he stumbled upon all of Price's research on root canals, which had been totally buried for maybe 50 years. And it was so staggering to him, especially given what he'd done for most of his professional life, which was to do root canals, that he basically assembled the information to put out this book. So basically both these books are based on the work of Dr. Weston Price. And what Price found is that one of the ways in which the root canal is most harmful to you is this. You have within any tooth, within the dentin, you have these little tubules, which are basically like little microscopic tunnels or passageways through a tooth. And within one tooth, you'd have miles and miles and miles of passageways. And when they, drill out the nerve and fill in the root canal tooth, it's not physically possible for them to actually fill in all those miles and miles of microscopic passageways. There's just absolutely no way they could do that. They're filling in the main chamber. So what happens is you have bacteria that would normally be occurring within the tooth, and once you've filled in once you've done the root canal, what you've done in all those little microscopic passageways is you've created a anaerobic environment. In other words, an environment that has little or no oxygen present. And so the bacteria that were formerly relatively harmless to you, they have to mutate into a different form because they have to adapt to the new environment they're in, which doesn't really have much oxygen in it. And this new form of the bacteria is very, very toxic. And the waste products that these bacteria are producing are getting right back out into your system, in fact, right out into your bloodstream, and affecting the body at a distance. They're affecting all different parts of your body. And what Dr. Price was able to show through many, many years of research is these bacteria, because of where they're located way up inside the teeth, there's no way to get at them with antibiotics. And he also was able to show that there's absolutely no way to sterilize the tooth prior to the root canal. And he tried this for years and years and years, and his conclusion was there was absolutely no way to get rid of these bacteria either before or after the root canal. So basically what you have is a little poison factory inside your head where these bacteria are pumping huge amounts of toxins directly into your bloodstream as long as you have the root canal there. Anita? Oh. The other thing that you'll find, too, is that as a result of the root canal, as John and Anita were mentioning, you get all these abscesses down into the bone. And so what people will get are what the dentists nowadays are calling cavitations, which are basically little hollow spots in the bone where the bone is rotted away. And I might add that you can't always even find these on x-rays. It's a very tricky process. Sometimes when the dentist is in there working around on the jawbone, it's kind of like dry rot. The wall looks pretty good until you tap on it and your hand goes right through it. And a lot of times that's the condition of the jawbone. So if any of you here have root canals, and I'm sure there's many of you that will, it's not enough to just get the tooth yanked out. I mean, that's the first step, but you actually have to get back down to clean, healthy bone.
Say that again, Doug.
It's not enough to just yank out the root canal teeth that you had. That's only a start. What you have to get the dentist to do is grind the bone down to where you're down to nothing but clean, healthy, solid bone. And they have to put this little burr on the end of the drill that kind of whirls around and grinds away at the bone there. I know this sounds like a lot of fun, but a lot of you will find, if you've had a root canal for many years, that you'll have all sorts of rot in the bone. And that has to be dealt with too. And sometimes it's quite a job, it's oral surgery here to get back down to healthy bone. And if you want to study into this a little bit further, you'll find that there are charts that are available that will show that the different teeth in the mouth will relate to different organs and glands. So if you have a tooth where you have a filling or a root canal or anything like that, or a missing tooth, that's going to have reflex implications to various organs and glands in your body. Like one tooth might reflex to your brain, something else to your heart, and so on. So, and what you'll find when you start to correlate your dental problems with your other health problems is you'll find that there's a real link there, and you're going to find that when you start to clean up your dental health by getting rid of your fillings and getting rid of your root canals and all the rest, you're not just going to improve in your dental health, you're going to improve everywhere else in your body, because the dental problems have been dragging everything else down as well.
Something that John touched on before, which you might find is a little out of the ordinary, but I'll say it anyway. What I experienced when I had my root canals pulled out was I saw all these spirits which were tied into death crystals leaving my body. And we'll get into word patterns later on in body electronics, but the death crystals are very, very strong. And this dead substance which you have in your body can hold in a lot of the death word patterns, like I want to die or similar things like this. And what I found when they pulled those 2 teeth out of mine, I saw a lot of all of those entities connected with that leaving my body. And we've also had another woman who the dentist actually got knocked over out of his seat because when he pulled a tooth out, the entity actually pushed him over in the chair. And he said he actually felt this spirit just coming right out of him, pushing him down, and he actually fell on the floor. So another reason for extracting these teeth. Yes, do you have a question back there?
Is that because, why is that? What came up for me when you said that was that Mercury is a metal, and metals exist in another dimension, and they have a whole different, whole different life processes and energies that go with them. So why are they going into the teeth?
No, I'm talking about the root canal teeth. The root canal teeth are actually dead. See, because they have no nerve supply, they have no circulation, so they're a dead substance. Yes, the entity is attached to, we're going to get into this in body electronics, but a lot of the depth word patterns, okay, you can hold then an entity in your auric field by the depth crystals, okay, the depth word patterns. Like, for instance, a person may have the word pattern, I want to die, or similar word patterns that involve depth. This holds in your auric field an entity. And because these teeth are dead material, the teeth are holding in the entities. Okay.
You think you want to get into body electronics, do you? You think you want to hold points on somebody and learn how to hold points and get the nerve supply and circulation back to their body? What you don't know is that oftentimes, as the nerve supply and circulation is restored to the human body, the holes in the auric field are closed up. And oftentimes, more so than not, you're going to get involved with entity releases. That you must understand that this does take place. We're going to talk about this on the third weekend and get into detail on this. But let me tell you an experience that I had in Chicago, because I saw a few eyebrows go up on the idea of entities, and there's a lot of channels today say there are no dark spirits, there are no entities, these do not exist.
Those would be dark spirits that are being channeled?
Yeah, dark spirits are doing the channeling. They're saying that they don't exist because they don't want to be exposed. Now, please understand this. I had a little girl who was 13 years of age. Her mother brought her to me back in Chicago. She had Down syndrome. She could only put no more than 3 words together at any one time. And she had the characteristic almond eyes, the big thick tongue, the short thick fingers, the very klutzy walk, where she could, how she walks along very awkwardly. And she had no feeling in her body, and she was always cutting herself, which she didn't feel, or hurting herself in some way with fire or with sharp things. And she had scars all over her body. She was totally unmanageable by her mother. Yet the mother, through motherly love, never gave up in working with her children, especially the Down syndrome child. So the mother, even if the child couldn't do anything, she had the daughter taking guitar lessons. And she couldn't strum a tune, much less keep in rhythm, much less hold a chord. She couldn't do a thing, but yet the mother paid this guitar teacher big money to endure the continual defeat of not being able to teach this little girl. The mother had hired a speech therapist from Chicago to watch after the little girl, to try to teach her how to speak, which of course the little girl couldn't learn anything and never made any noticeable improvement in even the simplest type of skills, educational skills. She had the mother had the daughter taking ballet lessons, which to me was like a elephant in a cabinet shop, in a china shop. That was disaster. But she had the daughter taking ballet lessons. Well, that went on for several years, from the time that the little girl was 3 years old, and the mother was insistent that the little girl was going to get better. Finally, after a number of lectures all over Chicago, and we had a whole raft of publicity in Chicago that raised a lot of interest in Chicago, that the mother asked if I would personally see her daughter, which I consented to do. And so we got the little girl on a program, and the mother was able to get the nutrients down her properly, the enzymes and the minerals and so on that we're yet to get into. Now I hope you're ready for this. I hope I'm ready for this. Linda, could you be kind enough to indulge this old man in something black and pure? I need something a little hot and warm. I lecture with a cup in my hand, as everyone knows, for years. And when my cup's empty, right here, just to clean out the dregs in the bottom, I remember this very well because this was my last patient before I was incarcerated. Because this little girl, we held points in a hotel, a motel room in outside of Chicago in a little suburb And we made a racket in there that was unbelievable, and they called the cops, so to speak. You got to be careful where you hold points, my friends. Anyway, this little girl was a little girl. We put her on the table and began holding points to restore the nerve supply and circulation to the body. Within a few short minutes, the little girl was no longer on a table. But something else was yelling at me, screaming at me in a man's voice, in a very loud voice, much like a show, if you've ever seen The Exorcist. Okay? This was shades of The Exorcist. We had the coldness in the room. We had the superhuman strength in the room. We had everything in that room going wrong. We had the little girl taking adult bodies and throwing them clear across the room, crashing into the walls. That made quite a racket, screaming at me at the top of this lung in this foreign male voice, threatening my life, questioning my ancestry, calling me every name in the book, if you can imagine, and just threatening my life, threatening the life of my children, my family, and everybody. And this became quite a disastrous situation here for everybody in the room, because there are about 50 people in the room. There's a large kind of a hall about half the size of this. And we were very busy, and the people had come to lend their support to this little girl, to getting her points held. The little girl would arch up and vomit up on me this gastric green jello-like material that had the stench of an overripe garbage can. That went on for 4 hours. And the mother kept wiping the junk off. We kept putting people back on the little girl to hold her still so we could complete the point, because once you start the process, you must complete it. Otherwise, you leave the person in the middle of this type of mess, and you can't do that. Once you start holding a point, you go through to completion. We'll explain this the third weekend. This voice became multiple voices coming out of the little girl. Multiple male voices. I don't recall any female voices, but I remember every one of these was threatening my very being, and it took every ounce of strength I had just to hold 2 points behind the back of the neck. It was a struggle. After about 4 hours of continual struggle, where I was determined not to give up or give in any manner, shape, or form, and after everyone else was thoroughly exhausted in trying to hold that little girl's body still so we could work with her properly, she finally got the nerve supply and circulation down through the body, and she says, "I'm hot." And the body was hot all over, and all of the scar tissue on the body disappeared. And she had beautiful skin from that point on. But all the scar tissue where she had cut herself and burned herself was completely gone. Her hands, instead of being short and stubby, became long and tapered of a 13-year-old girl. Her eyes, which were almond eyes, became normal eyes. Her tongue, which was all cracked and swollen in her mouth, which is common for your Down syndrome, became just a normal tongue. Are you hearing me? And she laid there by herself without anybody holding her down. And she was getting nerve supply and circulation down through the body, so on a little pinch test, we knew now that she had feeling, where before she did not have that. We'll talk about that in a couple of weeks on how to do that properly. We had this cold, icy wind coming out of her body, and the voices were no longer there. No longer any of these voices. We had a lady by the name of Florence. She was in her middle 70s, and she was very supportive of the body electronics work there in Chicago. After the points went flat, where there is no longer certain symptoms that you feel in your fingers, which we'll talk about in 2 weeks. We'll have to go with that into detail. After the points were flat and there's no longer any reaction, she had feeling all the way down through her body. All the scars disappeared on her body completely. I remember I was totally exhausted, and so was everyone else. It was quite a mental chore. But Florence took this little girl and walked her down the motel room. The police hadn't arrived yet, because it takes a while for anybody in Chicago to get any police help after screaming and yelling and carrying on for 4 hours in loud, screaming voices. I'm sure the management of the motel did everything they could to handle it. I was not about to stop in the middle of the process. After it was over and done with, and the little girl came back into the room, she came back into the room and she came over to me and said, "Thank you very, very much." In normal conversation, Florence expressed how the little girl couldn't be stopped in her expressing herself in long, fluent sentences. The little girl, to me, looked perfectly normal. The entity involvement was no longer there. She was in control of herself and could take instructions. At that time, the police came to the door, jerked me out like a common criminal, and took me all ganged and all in chains and whatnot down to the prison, threw me into a cell that I was a little indignant because it was much shorter than the length of my body, and I couldn't lay down, I couldn't sit down. It was just a terrible, terrible thing, and they treated me like a common criminal. And finally, I got bail, got out, and then what I told you about, I was incarcerated. We went through a 2-week-long jury trial. At the end of the jury trial, over the objection, if I might add, of the Attorney General for the state of Illinois who handled the case, they want to put me behind bars for 5 years, and the judge gave me a 1 year on parole, shall we say, where I didn't have to report to my parole officer, but told me to get out of the state of Illinois before something else would happen with these guys who are out to get me. And so I had to leave the state, and I just had 1 year on parole, and that was the end of it. But I was very, very happy about the whole thing, that I was able to get off, because I found out that they had, after I was guilty, there were 10 large articles about this quack that was teaching these principles on body electronics, and there were 10 stories in the Chicago Tribune, not one of which had 1 ounce of truth to it. They had me, everything in my history, background, and training, they had everything wrong, and they had created a story to totally decimate my character, which of course everyone knew was false, and that just simply added to the mystique of body electronics, and people kept doing it. In fact, they kept doing it because they were trained, and I just simply had to leave the state. But if I go back into the state of Illinois, it's an automatic felony. Sometimes it's all right to stick your head in the lion's mouth, but I don't think it's wise to continually be jerking on the tail. And so I have stayed out of Illinois, because the rule is if I go back into Illinois, immediately it's a felony. So that was the parole. So they got rid of me, but they didn't get rid of body electronics. But back to the little girl. After the 2-week court trial, I finally got a report from the mother. The mother said she took her daughter down to the speech therapist that she had hired all these years, and the speech therapist just sat in amazement, because she said every single block to learning was gone. All the paperwork which I had seen, the little girl was trying to do all the simplest little matching things, which a 3-year-old could do. All of a sudden, the girl took all of the paperwork, was able to go all the way through it, A+, letter perfect. And the speech therapist was amazed because the girl could talk in full-length sentences, no signs of any form of Down syndrome. The girl was taken to her guitar teacher, and the guitar teacher was blown away by the fact that she could not only play the songs with full chords and full rhythm and everything, she could form the chords very, very exceptionally well, do everything right according to his instructions. It just took her a while to catch up with all the instructions that were given to her. I don't know what happened in the ballet. I don't know, but she is a graceful little 13-year-old girl with no symptoms of Down syndrome whatsoever. With Down syndrome, we worked with a doctor in Sacramento where there was DNA change after the point holding. This goes back to about 1979, 1980. And this doctor there that did a lot of work on spines and with point holding and with the Down syndrome, that there was actually a change in the DNA structure itself by analysis. And so we had quite a bit of results there. I've just been informed that the salads are wilting out here. The lunch has been ready for 1 o'clock. And Carolyn will never forgive me if I don't dismiss. But I do want to say this in closing before we have a bite. This work is not for the weak-hearted. This work is one of the most important things that you can get involved in to help people and free them from the fetters, self-imposed fetters, if I might add, what I call the chains of death, that all of us are subject to. Anita properly calls this the death crystals. But the entity involvement in people, we must look at the fact that these things do indeed exist and not just poo-poo them as the fantasy of a distorted mind, because people, there are many, many people in the institutions that are sane as you and I are, except somewhere along the line they had a tremendous traumatic event happen to their life. They have entities involvement there which have control over them to where they have oftentimes some very severe, bizarre behavior. And we have the tools of working with that. And we have people working with people and getting them to the point where they're able to breathe sane breaths of fresh air again. Now, I want to share that with you in hopes that you will take this seriously and not just look at this as a technique of, shall we say, body manipulation. It's not that at all. It goes far beyond that into the psychological aspects of the human mind, the mental aspects, and the healing and regeneration of the physical body. So I hope this little story will help a lot, and hope that you don't just reject what I'm saying here, but put it up on the shelf, think about it for a while. It may go at cross currents to what you are normally taught in religious belief systems. But the thing is, when you look into the fact of the teachings of Jesus, entities are a reality. I think, what do they call them in the Bible? Evil spirits or familiar spirits or one thing or the other. And so these things are a part of history, and it's something we need to be aware of. Now, Linda, would you come up here and give us instructions as to what to do, because we don't want to deprive people of satisfying their hypoglycemia attacks. First, and we're going to do a demonstration, and if my hunches are correct, we're going to have something here that's worthwhile your full undivided attention, which will give you the importance of body electronics. Young lady, would you be kind enough to walk over here to me? Yes. And Trevor, if you'd be kind enough to just to lend your right hand to her left, so that she'd be able to very gently walk over here without her aid. Now this is her normal walking procedure. If you could get out of the way so everybody can see and get on the other side of the body. Her left hand here works. The right hand doesn't. Okay? Now, this is how she's walking now. We'll see a change in her walking when we're done. What was your name, ma'am? Eunice? Eunice Robertson. I would like to have 2 female volunteers who are color coordinated and at best who are trained, hopefully, in cosmetology. Anybody trained in cosmetology or trained in hairdressing? Anybody here trained in hairdressing? Anybody trained in art or color? Okay, Ruth, I need you as a witness. And who else? Elizabeth, you come up here. I need you. And Elizabeth and Ruth, would you be kind enough to be inspectors of hair color? I want you to inspect this lady's hair from the roots on out. Take a good close look at it. Look at the very small proportion of dark hairs. In some places there aren't any. I want you to check her from stem to stern, above the neck, and check for the color of the hair, if you would, please. And then watch the changes while we're doing the STO point, and the heart points, and the thymus point. Now, the assignments will be as follows. We're going to have at the head, I want a very experienced point holder. And so Simon, I have asked him to take care of the STO point, which will bring the nerve supply and circulation down through the body. Graham, raise your hand there and identify yourself, sir. Graham will be doing a heart point, wherein we will have to do 2 points, Graham. The point for the firing mechanism for the heart to correct her very irregular heartbeat. And Trevor, you'll be working on the heart and heart firing mechanism points to make sure that we have a good, strong heart and to correct the heart irregularities that she's been suffering from. Okay? I'll show you exactly what to do. And just remember, right for now, this will be new for you. Just do it my way. Okay? I expect I get along with people fine as long as they do it my way. All right, because over many years, 45 years of developing this, we know what to do. Okay, but we have to do it right. Now, Ruth will be checking the hair along with Elizabeth. So you might want to pull a chair or 2 right up over here so you can be right there on hand. And now, next part is important. Eunice, would you turn around, please? Okay, Eunice, would you show how far you can lift your left hand? Okay, left hand works fine. How about the left leg? Can you lift your left leg up? Okay, the thing is the right leg won't hold her up, so that's the problem we've got. How far can you lift your right leg? Just barely, just about 1 inch off the floor. Is that as high as you can go? Try it again. 2 inches off the floor. Okay. Now, how high can you lift your right arm? Well, go any higher. Well, go out to the side any further. Okay, do you get the picture of that? Trevor, you're going to have to get out of the way so people can see. You're going to have to get out of the way, sir. Okay. Now lift your right arm again as far as it'll go, Eunice. Right arm. Right arm. Okay, and you all see this. Now this is before. You got it? Got that mental image in your mind? I want you never to forget that, because if my hunch is correct, and so I'm not going to be touching her. We have 3 lovely gentlemen going to be touching her. And turn around, dear, and I want you all see the hair on the back of the neck. It's all pretty much white, just a few little bit of gray in there, with just a little bit of black in there in the hairs. Okay, now Trevor, if you can help her over to the table. And now remember, she can hardly move here. She's been on this walker for 6 years. She's had a stroke here, and things aren't working too well for her. And she's been doing a lot of praying, a lot of asking for divine help, and she's going to get it today. Now, if you gentlemen can help her on the table, just help her, steady her so she doesn't fall off the table. And we'll put the head down toward your side there, Ruth, on her back. Just on her back, and we'll just slip her down a little bit. Okay, turn the table around, be fine. Gently. Good. Hold that table solid. Now we're going to be going over these points specifically 2 weekends from now. This first weekend is Health and Human Mind, but we're going to be doing points to illustrate a point. And we're going to have now Simon on the STO point. Make sure all of the nails are cut very close so we don't draw any blood. Because sometimes if your nails are long...
Does anybody have nail clippers in the room?
Good. If you have your nails too long, you can hurt a person by pushing hard on a point and sometimes penetrating the skin. We don't want to do that, so we always make sure everyone cuts their fingers very short so that we're dealing with the pads of our fingers and not the nail. Okay? And we're going to have points on the heart area. 1 point will be on the side of the chest, on both left and the right side, wherein you have your... Pay close attention here, please. We'll have a line right across the nipple line here, meeting the line going down the side, what we call the anterior axillary line down the side of the chest. And there's a point where those two lines meet, and that's exactly where the heart point is if you have any heart condition. If you have an irregular heart point, you go about 2 inches up under the armpit for what we call the heart firing mechanism, and this will help to correct any irregular heartbeats. Now, if you have any pain on those points, when you feel them, you know that you need some work on that, because if there's pain there, that means there's a crystal there that need to be worked on. Okay, Elizabeth, do you have good memory on that? Ruth, you have good memory on that? Okay, Eunice is going to have some fun now. I'm going to, Doug, would you do me a favor, sir? Plug both Graham, I think Graham knows where the points are, Trevor doesn't, and could you plug Trevor into the heart and the heart firing mechanism on the right side? And Graham, if you could do it on the left. And if we have to move the chair or the table around a little bit, we need to do that. Pull it out a bit. You guys are big, you need to get some room behind the table. That's excellent. Somebody's going to get their purse all mashed. There we go. Thank you. So Doug, if you hit the heart point, Simon, if you hit the STO point, we need the heart point and the heart firing on both sides. This will be a thrill to everybody here. I love to work with stroke patients and MS and so on, because we always get the nerve supply and circulation down to the body, and then it's just a matter of time before we get the body back to full functioning, and I think you're going to see it here today. There'll be a worthwhile for all of you. This will be a first for many of you. Yes. We gave her some minerals just before we started to make sure we have a good shot of minerals to carry her through the first point holding. But she's been a vegetarian. Eunice, is that correct? She's been a good vegetarian. She eats a lot of fresh fruits and veggies, and so I think she'll be ready. If she was eating meat, I wouldn't chance it. But she's been doing a good job of eating properly. To get the best results, we have to get people off of their heavy meat eating, get them off of their ham first and then their red meat, and get them slowly off the chicken and get them off their fish so that eventually they're back to a good vegetarian diet. That's the way it was intended to be for the human body. We're not intended to eat meat because meat causes a great deal of toxicity because it is a long, long intestinal tract, and the meat can't move through fast enough before it starts creating a toxic reaction in the body, which the body reacts to. Okay. We're going to check the STO point now very carefully, Doug. Simon should know where it is by any question, but we've seen so many people make mistakes where the STO point is, right, Doug? And the STO has to be right on. If you're off a fourth of an inch to half an inch, you won't get the results you're looking for. Now I want to check this myself because this is important demonstration. I don't want anything to go awry. We want to have good results with this young lady. I sure haven't. Because that'll take about an hour and a half to 2 hours. Now it's exceedingly important, Doug, if you'll come around to this side of the table. Now, if we do a little pinch test on her left ankle, Eunice, do you feel that? You know he's there, but there's no pain, is there? Little pain there? Okay, but the right leg will be pretty numb. Not much there, is there? Nothing. There's nothing there. Now come up gradually on the inside of the leg and just give a very gentle pinch test. Feel that, Eunice? Nothing. Come up into the inside of the thigh. Anything? This is the last place where the feeling goes. She knows he's there, but there's no pain. Okay, there's nothing there. Now check the right arm where the stroke has affected the right arm, where we have very little motion. Any pain there? Just a little bit, nothing serious. Very little. Come on up higher. Anything there? Just a little bit, nothing serious at all. Huh? Yeah, she has nothing on the right side worth talking about. And this is wherein there's a lack of nerve supply. Now, if I were to take her over here, she'd probably say, you get that? Would you repeat that, please?
Oh.
And there's pain here on the left side, but if I take the right side and do the same thing, it's dead. Nothing there. And so there's no nerve supply on the right. There is nerve supply, very good nerve supply on the left. If I come down to just above the wrist, oh. Say it again. Oh. And there's pain there. I'm just giving her a very gentle pinch. But if I take down here on the right side, can you feel me poking away? You know there's somebody there, but there's no pain. Now, let's see what we got here, sir. Don't move. You're right on. You're right on. STO is right on the button. Now, Doug, plug him into both heart points and the heart firing mechanism, and we'll get that underway. Now, you'll have pain there. Oh. Feel the pain there?
Yeah.
Okay. The other thumb? Okay. We didn't have much on the right side, did we, Eunice? Nothing on the right side at all. Now, what will happen, several things, while these points are being held, what we'll have Graham, and we'll have Trevor feeling maybe numbness in the fingertips, which you often feel with a stroke, which will be the first thing that will come out is the numbness. And then we feel a lot of heat and a lot of radiation, and sometimes we feel a lot of electricity, which you'll find in the third book of the Logic and Sequence series. Don't read that. Read book 1 and get that under your belt first. Then read book 2 and get that under your belt. And then a year or so from now, read book 3. And you'll get that under your belt, and it'll be meaningful to you then, especially when you hold points and have your points held and understand the real powerful effect of body electronics. Now, the thing is, I want you, Eunice, to be aware here, and Elizabeth, come over here, please. Just hold this ready for Eunice to speak, because she's going to start getting feeling down through the body. This is going to be so exciting, and I think this will be wonderful. Got this here.
Well, she can have that one on her, and you can have mine too.
I don't need that.
All right.
Don't need it. Thank you. You'll need that. Now, in the meantime, Doug, if you'd be kind enough to start in on enzymes, and everyone can listen, and every so often at the end of each second or third area on enzymes, Anita, you chime in, and the two of you go for this. Anita, after I do an iris sclera integrated analysis, and which I'm trying to spend more time writing and more time teaching, and less time doing personal analysis work, so because there's enough people who's trained to do this, Anita spends about 2 hours with each patient to explain to them what we're going to go through here now rather laboriously, because many of you are going to want to learn this and apply this on your friends and enemies. And this will be something that you'll be learning in time, and because this will be one of the most important things for self-help when if the world continues as it is, we're going to have to be self-sufficient in all respects and learn how to handle things at home without depending upon other physicians and so on out there. We have to learn how to take care of ourselves. And this is yet to come, and you'll see it in your lifetime. Anyway, I'm going to ask here now, what's happening to your fingers right now?
Right. Well, the tips of my fingers are pretty warm. They're hot, and I can feel that I can feel the calcifications around the STA point.
Now watch. I'm going to show you how fast it's going to happen down here. Before, we were numb on the inside of the thigh. What's happening here, Eunice? Anything here? A little bit. That's it, okay? It's just about 8 inches above the knee. We have feeling down that far. And if I go up in this area here, how's that right there?
That's pinching me now. Yes, a little.
Okay. She wouldn't pay me to do that all day, but because she feels pain up here where before, where Doug was, it was numb. Nothing. Now, that's going to come down very, very quickly, and if I miss it, the feeling is all the way down. Let me check this out. Any pain down here yet? No. Still numb? Okay. Now, that should come down very quickly.
I got about 6 inches above her right knee. That's as high as I checked.
Anything here?
And there was no pain at all there.
Getting sore now, and that's just about 6 inches above the knee.
Yeah, I didn't check any higher, but 6
Okay.
inches above the
Now,
right
Doug,
knee.
would you check this? You felt it before, sir? And we're going to take time. If we miss our point here, you'll miss the fact that the nerve supply moves down.
Oh,
We have it. It's coming down very quickly. Now, can you lift your leg off the table, your right leg? Could you do that before? Not that high, okay? Bring it up a little higher if you can. Okay, could you bring it up that far before? No. Okay, I should have had that checked. I didn't show you. We do a lot of testing with people when we're, Can you bend your knee yet? Could you do that before?
not as much. I could do it a little bit, but not as much.
Bend your knee again, please.
Mm.
Feel different?
It is.
Okay. Now we should have feeling down to this point right about here now. Anything? It's down to the knee. See how fast it's coming down? Is it below the knee yet? Yep. Okay. Down here yet? Here? It's coming down below the knee where before it was dead. Now, you spend maybe a half hour working with a person. Is it worthwhile? Now, while you're doing that, Simon, could you just keep your fingers there and turn the head from one side to the other and have our hair analysis take a good close look at the color change. Look right at the nape of the neck now. Turn your head way over, Eunice.
No, John.
Nothing yet. Check the right here at the. I was going to.
Not yet, I don't think, John.
Nothing. Okay. No hurry. We've just been doing it for about 5 minutes. Okay. Let's see the right arm, young lady. Can you lift your arm? Just push it around here. Lift it back up. A little further that way. Lift it under the other arm over here. Graham, let her push the arm under there. Okay. Lift it right up straight. What's happening, young lady?
It's getting a bit better.
Can you put it over your head? You couldn't do that?
No.
No. Now, what's happening to your fingers? Now, before, it's kind of a... What happened then? What did you do just then?
I shut my head.
You couldn't do that?
No.
No. She can now ball her hand up in a fist. I checked her earlier. You couldn't do that. Is that worthwhile? You darn betcha.
Yeah.
Okay. Huh? Okay. We'll use the mic here. Put your arm just right over here, just across here. Back where it was. We'll check you in a few minutes. Down under. Okay. Bring your arm up here. Okay, let me just check you here now. Anything here yet?
Getting better.
Can you feel this now?
Yes, it's pinching me now.
It's pinching here. Before that was dead. Now, let's check the finger. Fingers are getting warm. Okay.
Oh, that's sore.
Talk to me.
That's sore when you do that. That's hurting.
Okay, this is sore. Okay, feel this here.
Ah.
That was numb. Completely numb. You got me? Okay, let's take the little finger, little pinky.
Hey.
And let's take the index finger right here. What's happening?
Oh.
Okay, take your fingers now, move. Now, you couldn't do that before. How's that feel?
It feels a bit better now.
Bring your arm up over your head again. Watch this. This is how fast it happens. Keep it going. Okay, straighten the arm out. I know the muscles after 6 years are going to be a little tight, okay? Take your hands, stretch the fingers out. Little jerky left, but she's doing it. How's that feel there, Eunice?
It feels good.
That feels good. Bring it clear back over your head and be careful of Simon. Now, hey, do you see this, folks? She couldn't move that arm up over her head at all. Now, go back and get Simon again. See if you can reach clear back and grab a hold of Simon. Keep going. How's that doing? Hey? Eunice, what's happening?
I'm reaching further back, I think.
Can you find his nose? Pinch it. Okay. Now, I don't dare do this now because I know that if it's coming down the hands, let's do this. Toes are getting very warm. Come up here real quick and feel the warmth in the toes.
I suffer with very hot feet.
See, it was ice cold before.
Mm.
Now watch this.
Ow!
That was number than a skunk, okay? And we got the, how's this? Okay? Every toe, it's all back. How long have we been working? Who's been timing me? About 10 minutes?
About that.
Okay. Now, with all due respect and dignity here, lift your right leg as high as it'll go. Keep going. Keep going. Bend your knee now. Bring it clear up. How's that feel?
It feels a bit better.
Okay, a little stiff yet, but you expect that after 6 years.
Mm.
Now wiggle your toes for me on the right side. Now, could you wiggle your toes before?
No.
No, look at that. Now, can you bend them way down? Bring it up. Bring your ankle up. Now bring your foot way down. And wiggle your toes back and forth now.
I'll wriggle my hand too. Just like,
That's alive. Now, you folks have had strokes in your family, different, your grandpa and grandma, numbness, no feeling in there at all.
Mm-hmm.
Hand feels, leg feels, foot feels. All the nerve supply is back. If the nerve supply gets back to the body, whether it's MS, whether it's cerebral palsy, whether it's a person who's been in a car wreck, okay? Where's Jill? Okay. You see it? You see it? You remember? Okay. The thing is, now lift your leg straight up. Don't bend the knee. Just that much is going to be, for a physiotherapist, nothing but absolute a miracle. You follow me?
yeah.
Okay. You hear me? And how much? Several $1,000s of physiotherapy, and but you still don't have feeling down here like this. And she won't pay me to do that, but she's tickled pink, so to speak. Her toes are now pink, and she's tickled pink that she has feeling down there. Eunice, pardon me for insulting you. I know that fist is in a good fist now. I'll stay out of range. Okay.
You've got me, haven't you?
I've got you right where we want you, and you're happy. Okay, take your arm and stick it up there toward over your head again, and watch how far this goes this time. What's happening? How's that feel there, Eunice?
Feels tight, but it's
Okay,
going
can you
back.
straighten your arm out just a little bit more? Muscles are kind of tight in there, aren't they?
Yes, around me joint there, but
Yeah.
around my elbow.
That'll come right. A little physiotherapy and she'll be fine. Now take your hand and just kind of go like this. Does that look a little different to you now?
Yes, it does.
Okay, now really take a good grip. Who wants to come up and take a hold of a dead hand that she couldn't move much and see what kind of grip she has?
She's got a good grip.
Okay, who else wants to feel this grip? There was no grip there. She could hardly hold anything.
Amazing. Yeah, amazing.
How's that feel, Eunice? Okay.
Lovely to shake your hand.
Feel that warm hand? Feel it firsthand so you can say, I've been there, done that. All right?
That's pretty good.
That's a good grip. Now, a person who's had a stroke will not have a grip like that. Is it worth it learning these points? You see what I'm saying? You can help thousands of people over your lifetime and teach other people some simple little points once you learn them, which we'll be learning the third weekend. Okay? Now, what's happening, sir?
The ends of my thumbs are all feeling quite numb, and there's a bit of warmth there beginning to appear, a bit of heat.
And the heart is now regular and strong, with no palpitations of any kind. Okay, what's happening on yours, sir?
My thumbs are numb too, and there's burning in the tips as well.
Okay, now what we have to do, you all listening, I need your attention on this. You never leave a point. Now, sometimes the point holders can go through a healing crisis by holding a point. They might want to irp and burp, and they might get vomiting and throwing up and going through old, shall we say, old visits to the pub, type of thing. And they might have all these things happen to them because the point holder goes through a healing crisis right with the person who's holding their points. Now, with the feeling getting all the way down through there, where's Ruth? Ah, check the hair now. Check the hair on the sideburns and on the nape of the neck.
Yeah, there's more colour on the sideburns,
What kind of color?
darker.
You find the dark hair coming through now, and it comes from the root all the way out to the end of the hair follicle, or the hair itself, where the hair actually becomes dark. Okay? How about the nape of the neck now? Now, of course, Eunice had trouble lifting her head before. Now, Eunice, just lift your head right straight up. All the muscles are back. Feel the difference on the strength in your muscles in the neck? What's happening on the nape of the neck? If there's nothing there, just tell me.
It's a bit much in shadow to tell, John.
It's too much in the shadow. Can you turn your head to one side, dear? Does that help?
Yeah, there is more colour there. It's like a brownie.
Okay. What color was your hair originally? Blonde. It's going to light brown now, from gray to light brown. Elizabeth, do you concur with that? Okay.
Yes.
Okay? Now, get this. When the central nervous system begins to heal, the hair turns back to its natural color gradually from the nape of the neck and the sideburns on up. And usually the hair starts going gray from the front and then goes on to the back, and the last spot to go will be in the back of the head. Okay? But it comes back. Now, take a look at the eyebrows here, Ruth. What's happening to the eyebrows? Elizabeth, come up here. These were white.
Yeah, there's definite colour in the eyebrows.
There's definite color in the eyebrows. Now, y'all got that?
Yep.
Okay? You agree with me? Now, look back right on the crown of the head. Just right on the crown right there. What do you see on that one little spot?
It's darker in the crown.
Darker in the crown. The crown right now is starting to get quite dark. Starting to, compared with the rest of it. Okay, you see that? You see that area right back there? Okay. Now let's see, what else is there? It's coming good. Now, lift your leg up, dear. Bend your knee. Come all the way down. Bring your leg right on up there. You should feel a lot of difference there. How's that feel? Is that stiffness starting to go away in the muscles? Say it again.
It's starting to go away.
Okay. Now take your arm and push that right up to above your head. There we go. Way up high. And what do you see is happening? Okay, now take your arm this way and move it out, back and forth there. That should loosen that up there around the elbow where it's all frozen. That's still frozen there. We'll have to take a while and work that out. Oh, it's moving. See, it's opening up now a little bit. Feel the difference there, Eunice?
Yeah, feel a little bit.
Okay, now for everybody and just take your hand and clamp it back and forth now. See how fast this is going now and how strong it is? Somebody else want to feel the grip she had on her hand? Who else want to do that? Okay.
Wonderful. Fabulous.
Now, who felt the grip the first time? Come up here, please, and feel the difference now.
It's stronger.
Stronger. That's right. And, it's kind of nice. Now, what we do now is, if everything was happening so fast here, we didn't really have time to get into a lecture. You understand that. But we'll get into that now, Doug. I think we've got plenty here done. And we'll now wait until the points go flat. And that's when there's no more heat, no more numbness, no more electricity, no more whatever happens. And so we'll just wait till the points go flat. And you never, never, never leave a person in the middle of a healing crisis. If this will do that for a heart or for the stroke, for example, in this short a time, what will it do for other problems that need to have regeneration also? What is the medical approach to a person who's had a stroke for 6 years and they're numb in the feet and numb in the arms? What do they tell you? Nothing you can do, it'll never come back. Okay? They tell you to put up with it. And frankly, do you see what's happening here? I'd like the whole world to know about it. And then you folks learn this sort of thing and you get busy and you help as many people as you can. Because it's not happening anywhere else. And you have several factors entering in. Tremendous financial drain on society. Secondly, people are no longer able to do the thing that they love best, which is get out and be productive and earn a living. Okay? And number three, for every sick person, it's going to take about 2 people to take care of them, for the most part. And this will help increase the activity of all of Australia morphogenetically. You get 100, what did we figure the other day for Australia? 450 people? 500 people? You get 500 people involved in this work, which we already have, and you have a very, very rapid change in the consciousness of all of Australia. We have that now. We have another 50 people here, roughly. Okay, so just start thinking, start projecting, and for every one person that you tell, and they believe you, and they have a change of consciousness that's going to affect morphogenetically everybody they're tied into at some level. And after a while, we have a demand across the board for freedom of choice in health care. And that's what we will work for. Any questions before we go on? There's somebody has something you want to really ask about. Who is it? Yes, sir? Come up here.
No, what I was wondering, why you only picked, say, 3 spots to work on at once, when I've heard these other groups, they work on the whole, every point at once. They work on many, many points at once, and you're just picking 3.
Yeah.
Any particular reason?
I chose 3 people because I didn't want to use the minerals up too fast. Because if the minerals are used up, which could happen, right now, you feel the heat going down the spine? Hey?
A little bit, a little bit.
You feel the heat just warm?
Yes.
Okay. We're getting the warmth going right down the spine, and so that is the spinal cord. And this, when that happens, we'll use up tremendous amount of minerals. And then what will happen is we'll start heating up and cooling down and heating up and cooling down, and we cycle, and that means we've run out of minerals. And so we send a person home and then come back for point holding a week later after the minerals and nutrients are built up in the body, which we haven't talked about yet. So,
Thank you.
Okay.
If the point isn't finished and the person's left in a healing crisis, does that also stress the organ that the point refers to?
A person is very happy to have that organ stressed for a while because it hasn't been stressed for a long time. But the thing is as soon as you get the person back on a good nutritional program, you go back and finish the points off. And that will be your responsibility, Eunice, if we get into a cycling. But you have enough help here in Brisbane, and there are friends of yours that would like to help out too, that when they see what's happening to you, they'd be tickled pink to come over and be a part of this. Okay? Turn your head over this way. Ah. See the black coming in here? Look at this right through here, girls. That's beautiful. I want to see that crown straight on. Oh, yeah. Yeah, that's coming nicely. Turn your head way over to this side. Go with her. How's it in the back?
Yep, more colour. More colour.
Lots more colour, yep.
Okay. And this is where, as you've seen people who are into trauma, their hair turns white overnight. When that trauma is released and the nerve supply is back to the body, then that trauma is reversed and the hair comes back to its natural color. And this means the central nervous system is now healing properly. You want to see it, sir?
John, one question. You said not to leave the points. The reason?
You don't leave the person in the middle of a healing crisis. It's very, very difficult unless they run out of nutrients and you can't go past that point. And so you send them home. You make sure you're in good communication with them as a support team, and you work with them as best you can. And then you come back. My. What color was this? What color was it?
Grey, I think.
That was great. Look at the eyebrow. The eyebrow is darkening right up nicely. You can see it right here. And what's happening to your body?
Well, it seems to be getting the blood supply to it a bit.
Okay, wiggle your toes for me now. The feet, the ankle. What does that feel like to you?
Feels good.
Oh, I just asked here, to wiggle the toes, and the right foot's doing fine. Move your left leg up as high as it'll go. Left leg, just move your left leg up. Okay, now move your right leg up as high as it'll go. You feel different there?
Yes. What's happening? Seems to be loosening up. It's a bit tight yet. I've been like that for so long.
You haven't done that first?
No.
Okay. Isn't that beautiful?
Mm.
Okay. Anita? Doug, take over on enzymes, would you please? Okay. Never mind, hon. I know. Terrible sense of humor. You call a person just when they're on their way out to the loo.
Okay, I guess we're going to talk about enzymes, and if you might want to get to page 30 of the patient guide. So turn to page 30 of the patient guide, 12 points on enzymes. Okay, number one, enzymes rule over all other nutrients. Enzymes are responsible for nearly every facet of life and health and far outweigh the importance of every other nutrient. I just refer you to a couple of books here on the subject. The author is Dr. Edward Howell, Howell, Dr. Edward Howell. And this is a book that he wrote in, I believe, around 1981 or so. It's called Enzyme Nutrition. And this is probably the best book out there on enzymes that you'll find anywhere. Most of the other books on enzymes are pretty much just derivative of his work. So Enzyme Nutrition by Dr. Edward Howell. And he actually also had an earlier book that came out around 1940 or so that was called Food Enzymes for Health and Longevity. And that's quite a good one as well. If you were to only get one of them, I'd recommend this one because it's more up to date. But Enzyme Nutrition and Food Enzymes for Health and Longevity by Dr. Edward Howell would be pretty much the definitive works on enzymes that are available now. Number two, enzymes are needed to help control all mental and physical functions. Each body cell has in excess of 100,000 enzyme particles necessary for metabolic processes. Number three, enzymes cannot function properly without the presence of other substances which are known as coenzymes. Coenzymes are minerals, vitamins, and proteins. I believe we'd probably also include essential fatty acids in that category at this point. Would that be correct, John? As a coenzyme, would you include essential fatty acids? This is something that was compiled. We'll be talking about essential fatty acids a little bit later on, but that's something that we've really only been aware of and looking into for about maybe 6 or 7 years now, and this kind of predates that, so you can sort of add that in there, that coenzymes would include the essential fatty acids as well as the minerals, vitamins, and proteins.
Interruption time. You there? Put me on over here on the, you're with me, okay. Eunice is going to perform for you now, which she couldn't do before because she had a stroke and her right hand wouldn't work. So Eunice, raise your hand up high. Show what you can do with your fingers now. Take each finger, see it? Fourth, third, second, and that's just about as good as you can do it. You see that? Now before, could you hold your hand up there, Eunice, and show what you could do before? No, but before we started. How was your hand working at that time? Just about like that. It was just a little bit of motion. I saw that, just a tiny bit of motion, and she couldn't do that. But now we have specific activity rather than generalized activity. Now you understand from a physiotherapist point of view that when a lot of people, they have general activity where they might be able to swing their arm like this a little bit, but they don't have that specific activity, which we now have. You all see that? Now, please understand that people, when you first tell them this, they say, I don't believe you. And then if you insist on it, they know that you're totally lying to them to give them false hope. Be patient with the folks Just be patient with them. Those that appear to be your greatest enemies and those that will jest at you the loudest and laugh at you and criticize you will end up eventually being your closest friends and allies. All right? So just don't get discouraged if somebody doesn't believe you right off by saying what you have seen here. Now take Brisbane, for example, 1 million people. Take 40 people, over a year's time you might talk to 100 people. How many is that? That's about 4,000 people, isn't it? Okay, 4,000, and each of them tells 10. How many is that? 40,000, and after a while, the whole city is hearing about this. 50% will be jesting. The other 50% will want to find out about it. Therefore, you're going to have as much knowledge under your belt as you can to be of service to your friends. Okay, because as far... Okay, we have a little message right here.
Hair colour coming through at the front of the head. Just a few little stray black hairs, but there weren't any there before. It was all white. Okay, let's look at the side there again, the sideburns. Get behind the ear. This is exciting to me. Look back behind the ear here. Yep. See all that? Yep. Much more. Much more.
Okay, Elizabeth?
Yeah, there's a lot more colour there now.
It didn't all turn black at once, but if it turned black a little bit on the first point holding, what does that tell you if a person keeps this up with a good nutritional program? Everything happens for the good. Doug, sorry for taking so much time and interrupt here, but this is...
I thought I was the interruption.
This is Eunice's moment of pleasure. Okay.
Okay? Okay, number 4. Once enzymes have completed their appointed task, they are destroyed. For life to continue, you must have a constant enzyme supply, which requires continual replacement of enzymes. One way of...
Okay. Just look at the eyebrow there on this side, right in here, dear.
Yes, oh, that's good.
I mean, you're the one who has to get the pleasure.
Mm.
See the color?
Yeah.
It's not a whole lot.
No,
But,
but
I think
no,
you
no.
ought to look over here at these mutton chops.
Definitely comes from
Look at the color in here. A whole lot of dark.
I don't think I had any dark hair along. It was all grey.
That's right. See it?
Mm.
That's exciting.
One way to think of it with enzymes is this: you're basically using up enzymes on a continual basis, just being alive, and you can sort of think of it like a bank account. I mean, just being alive and using up enzymes is like that's a constant process of withdrawal or of depletion of your enzyme bank account. And obviously, if you make a lot of withdrawals and never put any deposits in, it's only a matter of time before you're pretty well out of enzymes. So the thing to realize is, in order for your life to continue in a healthy fashion, you have to constantly be adding to your enzyme potential. You have to be constantly taking enzymes into the system. And there's really 2 main ways of doing that. One is to eat raw foods that haven't had the enzyme content destroyed. And the other way, which we would also highly recommend, would be to take enzyme supplements that are going to work in the body. If you take an average individual where they're on a diet that's very, very low in enzymes, they're clearly going to be using up enzymes at a much greater rate than they're replenishing them. So what's going to happen over time is the enzyme levels in the body are going to steadily decline. And as the enzyme levels decline, you're going to be prone to all sorts of illnesses. You're going to take a longer time to recover from things. You're going to get sicker more often. There's going to be all sorts of things that are going to happen for no better reason than that you're getting increasingly enzyme deficient as the years go by. Number 5, enzymes are found in all living cells, including raw foods, or those that are cooked at a temperature lower than 116 degrees Fahrenheit, which is about that's roughly 47 degrees centigrade or Celsius. That's this temperature at which enzymes will start to get destroyed. Actually, some enzymes will get destroyed even at slightly lower temperatures, maybe down around 43, 44. But bottom line, if you're looking at any type of cooking, you can pretty well rest assured that all the enzymes have been destroyed, because obviously any cooking that you're going to do is going to be at much higher temperatures than that. So a diet that's primarily composed of cooked food, which is what most of us have grown up on, is going to be a diet that's going to be extremely deficient in enzymes. Question?
Oh.
There was a study in Switzerland made on cooked food, canned food, frozen food, and raw food, fresh raw food. And they found out that if a person consumed canned food, cooked food, or frozen food, that person would have an increase in the white blood cell count, which we call phagocytosis. It's where there's an increase in the white blood cell count, showing a low-level infection in the body. A person who ate fresh and raw food would not have this phagocytosis or an increase in the white blood cell count. Now, we find that if people eat cooked food, the cooked food destroys the enzymes, and you have to have extra enzymes taken internally as a supplement to help to remedy the lack of enzymes done from cooking. But there's also a molecular change to the material that is cooked, which renders it toxic to the body, which causes it to have that increase in the phagocytosis. And therefore, people who eat cooked food have a very difficult time getting well, not only because the food that you eat that is cooked, frozen, or canned will be toxic to the body, and the body has to work overtime to correct that. And sometimes you have to understand that if nothing nutritious is going in the body, then you're not going to be able to get well from the, shall we say, the breakdown you have through the cooked food. So we recommend eating fresh and raw food, or else you add to the long-standing enzyme deficiencies in the body, which is one of the prime causes for any type of a breakdown in the tissues of the body, resulting in illness of various kinds.
Just one thing on temperature. For the people who have the bottled enzymes, be careful that you don't leave them in heat or on windowsills, or even we found in our suitcase one time there was some sun on it, and the enzymes lost their potency. So they are very highly reactive to heat.
Definitely don't leave them in the car.
And don't leave them in the car, no. Could we have a report down there from...
Oh, no, I can't.
Down there, Eunice?
Beg your pardon?
What's happening?
Oh, I've got a pain in my knee now.
Don't move it. Which knee?
My right knee.
Okay. Is it burning in there yet?
Well, I've had it for some time.
Pardon me?
I've had it before. I get it every morning. When I wake up, I try to straighten my foot.
Don't move it. Did you ever injure that leg earlier in life?
No.
About when you're about 6 years old, did you ever hurt your leg?
Oh, not that I know of.
Did you ever have pain in your ankle?
It feels like arthritis in my knee.
Okay. You tell Arthur to leave here. He's the worst of those Ritus brothers. Okay. Now you take that pain there and just feel that pain. And one of the things we have in body electronics is just lovingly and willingly endure the pain, and that transmutes it. And then you might find that you hurt your knee as a younger child.
Yeah. I might have, I don't know.
You never broke a leg?
No, I've never broken
Sprained an
it.
ankle?
No,
You sure?
not that I know. I've never had any breaks with bones or
Okay.
ankles or anything like that.
That's good. Then just feel the pain in that knee, and after a while you'll find out where it's coming from. Bend your knee and see if it's coming a little clearer. How's that feel?
Feels good, feels better when I bend my knee than it does when I'm trying to straighten it.
Okay. Now, what are the point holders getting?
I'm getting a bit of warmth still.
Still warmth? No heating up and cooling down? No. Oftentimes in the first point holding we have that cycling. Watch for it.
Yeah, and I'm still getting quite a bit of heat on the left side of the STO.
Okay, should we check for hair? I love this.
It's a lot darker. It's getting a lot more colour.
What's happening, Elizabeth?
It's getting a lot more colour.
Where?
Darker, down the side, at the sideburns.
Down the sideburns? How about in the back of the head on the nape?
Yeah.
Talk to us and describe what you see.
Yeah, it's getting a lot more colour at the back
Okay.
too.
Can you turn the head to the side? Ruth, can you see from there?
There's more colour interspersed throughout the hair. Colours coming through.
Okay.
Yeah, it's much darker. It's not white any longer.
It's not white at the nape?
Well, there's a lot of grey coming through. A lot of darker colour.
Okay. We'll all see that when
There's
we're
still
done.
grey. There's still grey at the nape, but there's a lot more colour there.
That's beautiful. Okay. Doug, continue on, sir.
The degree of enzyme destruction is a function of time and temperature. But basically, when you're getting into the temperatures that you're looking at with cooking, pretty much any amount of exposure to that temperature is going to wipe out all the enzymes. So, you know, the simplicity of this basically is if you cook the food, it's really not going to have any enzyme activity left in it at all. All the enzymes will have been destroyed by the cooking process. One study that was done, that Dr. Howell reports that's fairly interesting, is they took a small hospital down in the state of Florida, I believe, which is about 90, I think around 90 or 100 bed hospital, a fairly 100 bed hospital, and they took the patients there in the hospital, and the only thing that they did was they gave every one of the patients 2 capsules of food enzymes with every meal. They didn't change the diet. They didn't change the activities that people were doing. Nothing else in their daily, program changed at all. But they simply added 2 capsules of food enzymes with every meal. And what happened was about 90% of the symptoms that these people were suffering from disappeared quite rapidly, for the simple reason that the people were now digesting their food better as a result of the enzymes. The enzyme levels were starting to come up in the tissues, and basically overall the bodies just started working better. So doing nothing but taking a small amount of enzymes, you had about 90% of the symptoms that these people in the hospital were suffering from disappear in quite a short time. Okay. Number 6, enzymes are primarily proteins, yet enzymes need amino acids for normal function. Hormones are primarily proteins, which require interaction with enzymes to regulate body processes.
Tomorrow we're going to have a speaker here for a short time, which will talk to, he's one of the world authorities on amino acids and acidophilus. And he'll be coming here and we'll be going into great detail on this material. And I think that you'll be wonderfully blessed by his presence, because he'll explain to you some of the things that he's doing, which is a first in the world, as far as I know about. And we'll talk about that at that time. But tomorrow is going to be a very good day. He'll be coming in the morning, tomorrow morning, to discuss some of these concepts with us.
One of the tendencies I think that many people will fall into when they start studying nutrition and start studying health is to get very, very hooked on one particular idea, one particular supplement, one particular concept, to the exclusion of everything else. And so I think it's really, really important that as we as we look at these different things, whether it's mercury or fluoride or enzymes or minerals or any of these other things, to realize that none of these things is anywhere near the whole puzzle all by itself. These are all just pieces of the puzzle. So on the one hand, we're certainly going to tell you that enzymes are very, very, very important, but no matter how many enzymes you take, if you're still mineral deficient, if you're still deficient in essential fatty acids, if you're vitamin deficient, if you're deficient in amino acids and any of a number of other things, oxygen deficient, then you're really only going to get very partial results. So I want to make it very, very clear here that when we try to put people on a nutritional program, we're trying to really cover all of our bases. Certainly enzymes are going to be very, very prominent on the list of things that we're going to deal with. I mean, as John says here, enzymes rule over all other nutrients. So if you really wanted to put something up in the sort of the top of the scale, it would probably be enzymes. But all the same, the enzymes aren't going to do you that much good if you're not getting minerals, if you're not getting essential fatty acids, if you're not getting acidophilus, if you're not getting amino acids, vitamins, and all these other necessary substances. So try to sort of avoid the it's what the medical paradigm is, sort of that silver bullet theory. One thing for you just have to do this one thing and everything takes care of itself. And we want to learn to look at this from a broader perspective and recognize there's a lot of different things we have to take care of.
Let's talk about one thing that we need to understand. A lot of you here are fresh and raw vegetarian. With all due respect, some of the sickest people I know are fresh and raw vegetarians. Why? Because they eat a lot of cooked food. Now, the macrobiotic diet that many of you are probably familiar with, you are encouraged to control the pH of the body, which is as good as far as it goes. But when you're on a macrobiotic diet, what type of food are you eating? Cooked food. So, what happens with a macrobiotic diet is you feel good as you're dying slowly due to an enzyme deficiency in the body. You're not getting a change in the color of the eye. You're not getting change in the structures of the eye. The eye remains the same, and the people on macrobiotic diets have never seen eye color change because they haven't enough enzymes in their body to help to bring about the changes in the cellular level of the body to let go of the crystalline structures that are there that allow the person to go through a healing crisis. So one thing we have to look at very carefully, and by the way, I'm going to repeat that for you. You can quote me as much as you want. That people who are on a macrobiotic diet, they feel good because the pH is balanced, as they are dying slowly due to an enzyme deficiency. Because if you don't have the enzymes in your body, when the enzymes are depleted in the body, you die. It's that simple. You have to have a continual replacement of enzymes. If you eat cooked food, your body requires more enzymes to correct that cooked food condition, and you're dying slowly as long as you're eating cooked food. When you change that and eat fresh and raw food, you have enough enzymes in your fresh and raw food to digest the fresh and raw food, and that is what the enzymes were designed for. If you're taking food that has been harvested, say 2 weeks ago, put in a cooler, shipped to a distributor, shipped finally to a store, put in the cold room in the store, and then brought out to fill in the gaps as people buy the produce, oftentimes that produce has lost its nutritional value by waiting a couple of weeks before people consume it. All right? So the enzymes may be there only in part. The vitamins and essential nutrients may be there only in part. Please keep that in mind. Now the next thing is, because we have had so much cooked food over such a long period of time, we are suffering now from enzyme deficiency, which is one of the main causes for the gradual breakdown of the tissues in the body and a precursor to illness. So what we need to realize Just eating fresh and raw isn't going to do it for us. We have to correct long-standing enzyme deficiencies to bring the body back in its reservoir of your enzymes in order to bring the health of the body back. And it's not going to be just on a fresh and raw vegetarian diet. It's not going to be enough. You need to correct the long-standing enzyme deficiencies due to a lack of knowledge by eating a lot of cooked food. You with me on this? Am I boring you, silly? Okay. This is something you've got to understand. We're into some real deep material here that you've got to understand this. Because you take this home and try to explain it to your wife and she'll laugh at you. Because she's been eating cooked food all of her life and she feels fine as she's 40 pounds overweight. Why is she 40 pounds overweight? Because the enzymes are not there to affect the digestion properly, so that all of the amino acids are there, so that the hormones are going to be created out of all 20 amino acids. If you eat cooked food, 2 of your 8 essential amino acids will not be there. And therefore, you're not going to create the rest of the amino acids for a total of 20 that the body needs for hormone secretion and production. Are you with me on this? I should say production and then secretion, so that all the hormones will be there. If one of the 20 hormones is gone or is absent, then you're not going to get the human growth hormone there, which will help to build up strong muscular bodies and take away the extra amount of fat, which is called the middle-age spread. And this is due to eating cooked food and not knowing that the cooked food destroys at 110 degrees Fahrenheit, it destroys tryptophan and lysine, which are 2 of your 8 essential amino acids. And you need all 8 essential amino acids to manufacture the remainder for the total of 20. And so people then they suffer from hormone deficiencies and don't know what the problems are. And the medical doctor is not going to tell them to eat fresh and raw food. You with me? They're going to say you want a broad range, good nutritional diet. Eat lots of ham sandwiches, you know. Eat lots of eggs, eat lots of meat, drink lots of milk, and eat lots of cheese, you know, and get your protein. Can I just say nonsense to all that? We'll explain this as we go along. Because what the typical nutritional diet that is recommended in the hospitals are designed to keep people there. Did I make that clear? The food that we have, that we eat, is designed to keep us in the hospital, that the nutritionists prepare for us, because their findings are given by these large industries who have paid for research to support the industries. And so you want to have a good nutritional food, then, you know, the company will put forth money for research to prove what the research is doing. And we're all subject to that type of treatment. It's a kind of a difficult thing. Okay, but at bottom line, we have to correct long-standing enzyme deficiencies to make sure that we're able to bring the body back to a position of vibrant health. Go ahead, Doug, please.
Okay, number 7. Enzymes aid in transforming proteins into amino acids. Protein does not perform its function in the body unless broken down into amino acids. Amino acids can be considered as an enzyme carrier whose function is to transport enzymes to various functions in the body. As John has said here, it really doesn't make much difference how much protein you eat. It doesn't do you a bit of good if you don't actually break it down, if you don't digest it and assimilate it. So a lot of people eat huge quantities of protein and actually get very, very little benefit from it, because until that protein is broken down in your system into its building blocks, the amino acids, it's it's actually worse than useless to you. It's actually something that's probably going to clog up your system and be a real problem. So a lot of people who are having trouble with different things in the body will end up consuming more and more protein, and it does them less and less good because they're not digesting and assimilating it. The best solution for most people really is to to get a good quality protein that you can actually use, which we'll talk about tomorrow, but most importantly to make sure that you're digesting and assimilating the protein you are consuming. And that's impossible without enzymes. And this is why no matter where we look, we always come back to the enzymes as the most important nutrient, because everything else in the body is going to depend on the presence and the activity of the enzymes. Okay. Number 8, enzymes help extract chelated minerals from food. Enzymes transform chelated minerals, and this is a very important one. Enzymes transform chelated minerals into an alkaline detoxifying agent, which combines with acid cellular wastes and toxic settlements within the body, thus neutralizing them and preparing them for elimination. The bottom line is, if you want to detoxify the body, the two things that you probably need above all else are a good source of minerals and a good source of enzymes, because it's the minerals and the enzymes working together that are going to detoxify the body. You remember John talked earlier about the woman who had all the black spots in her eyes. And even though she was taking large quantities of minerals and lots of other supplements, she didn't get any change whatsoever in the eyes because she wasn't getting any enzymes, because they didn't know about enzyme supplements then, and she wasn't eating any fresh and raw food. As soon as she got on the enzymes from the fresh and raw food, in addition to the minerals that she was already taking and everything else, that's when she started to get all the change, and all the black spots and all the dark brown spots started to lighten up and disappear from her eyes. So at a bare minimum, you have to have the minerals and enzymes to work together to detoxify the body. Obviously, it's much more helpful if you can have a lot of the other nutrients that we'll be talking about, but the minerals and the enzymes are definitely the things that you have to start off with. Just something as simple as this point holding session here. She needs minerals in order to get the job done. She needs enzymes in order to get the job done. A lot of other nutrients won't hurt, but you need to have all the basics here if you're going to get any kind of results with a person. Questions?
If we get all the amino acids, shouldn't we find the body then makes these enzymes? Because they're mainly amino acids from what I hear.
The body very definitely does manufacture enzymes, but the thing to realize is it doesn't do it for free. I mean, in other words, the body can make enzymes, but it's always at a cost. And if you study Dr. Howell's works very carefully, one of the things that you'll be struck by, which is really quite fundamental, is the body will do everything possible to conserve its own enzyme potential. The body will never, ever use any of its own enzymes up digesting food unless it has to. And this is very easily verified by all sorts of studies that have been done. But basically, if you give the body a meal that's either composed of raw foods or supplemented with a food enzyme supplement, the body will always use those enzymes that have come in from outside to digest the meal before it will use up even one little enzyme of its own. It only uses its own enzymes for digestive purposes as an absolute last resort. The body's very, very intelligent that way.
Good, thank you.
I mean, you could go into a lot more detail on your question, but I think just from a perspective of common sense, just look at what the body does. And the body will use outside enzymes first and only use its own enzymes for digestion as an absolute last resort.
Now, from an iridology point of view, you've noticed how when you have a brown eye, the green starts coming through the outside of the peripheral portion of the eye and starts moving in slowly, so that the last place where the brown disappears will be right around zone 1 and 2, which is just outside of the pupil. You've seen that. Okay, now the digestive system is the last place where the enzymes are utilized. And when the digestive system goes, the entire body goes. Now, the pancreas is part of that digestive system. And that's why about 95% of people in Australia are going to have hypoglycemia or on the way to diabetes, which is step 2, with hypoglycemia being step 1. I've seen a lot of people here in Australia that have hypoglycemia since we've been here. Okay? Now, this shows to me that they have had a lot of cooked food in their time. And that's going to rob the body of enzymes. And the body will conserve enzymes for the digestive system last. And then when there is a severe enzyme deficiency in the body, and the pancreas cannot rob enzymes from the other parts of the body to keep the pancreas working, then the pancreas will begin to fail. And there's not enough enzymes there then to break down your food properly. And because there's not enough enzymes occurring from the pancreas, namely pancreatic enzymes to help to break down the protein, lipase enzymes to help break down the fats, and amyloidic enzymes to help break down the carbohydrate, when those are diminished in the body starts to die. And that's when we start having more and more problems and very rapid breakdown, cataracts forming in the eye, liver disease, kidney failure, and then the digestion just doesn't work anymore. Now during this time, when the digestion is not working, you'll have a tremendous amount of mucoprotein in the body building up. The mucoprotein is a combination of undigested protein, or what we will call the long chains of polypeptide material, which is your undigested protein, and your undigested carbohydrate in the form of complex carbohydrate that hasn't yet been broken down into sugar. So we have a very serious condition here when this takes place. And this mucoprotein then ends up as what they call a conjugate. It's like a sludge that exists in the interstitial spaces between the capillary and the cells, making it impossible for nutrients to reach the cells, making it impossible for toxins to leave the cells and be eliminated through the lymphatic system, because usually the lymphatic system will be all clogged up. And so this mucoprotein will be a precursor for lymphatic congestion in the body. And this is when the cells get sick and the cells start proliferating, shall we say, sick cells. And you have cancer and everything else go wrong with the body. So, one of the first things we have to do is to get rid of your mucoprotein in the body, which is putting additional proteolytic enzymes in the body and additional amyloidic enzymes in the body, okay, which then will gradually digest out this accumulated mucoprotein. And we have the enzymes that are designed to do that. Now, when that mucoprotein starts coming out, we have people where their sinuses start draining, or they start having a tremendous amount of what we call catarrh coming out of the system, and you don't want to stop the flow of this. Now, from a medical point of view, and the medical doctors think this is wonderful stuff, if you have a lot of sludge and catarrh and your nose is running, your ears are running, your eyes are running, take a lot of vitamin C. And that stops instantly that problem that you're having. When in reality, on the material that's going to be passed out to you a little later today to take home and read, it'll explain very fully on the material on vitamin C that I'll be passing out to you, or will be passed out to you, that material on vitamin C suppresses the symptoms of disease. For example, you have a bladder infection, you take a massive amount of your ascorbic acid or vitamin C, and of course instantly the bladder infection goes away. But you continue eating a lot of fresh foods and a lot of things like that, and bingo, back comes the bladder infection again. So you take more ascorbic acid, the bladder infection goes away. You play yo-yo with this for a number of years. But as long as you're taking ascorbic acid, everything is suppressed. Your nose doesn't run, your feet won't smell, you'll have no problems. I hope you get the joke on that. Anyway, what happens is when everything begins to cleanse, then everything is backwards. Your nose will be running and your feet will be smelling. And everything starts to come out, every part of the body, every pore of the body. You don't want to stop a flow when it happens. You want it to go and go and go until it's done. And then you'll see the mucoprotein disappear in the iris of the eye. And that's exciting, because that's one of the most detrimental things that we have, is that trying to figure out what you do with the mucoprotein. It wasn't until the 1980s when I saw this lymphatic rosary, which we call the mucoprotein. We'll be talking about this next week. We'll show you a lot of pictures of it. I didn't know how to get rid of that mucoprotein. And I started to study it very carefully and found out it is simply a combination of undigested protein and undigested carbohydrate. So you put heavy enzymes into the body, and a tremendous amount of enzymes. It breaks down that mucoprotein. It comes out, running out from every orifice in the body. And you have a lot of cleansing reaction going on in the body, and the body begins to heal and straighten out. And so you'll see that. We'll talk about this even in greater detail next weekend. So this is something that is something to look forward to on this area. But in the meantime, you take additional proteolytic enzymes for the protein digestion and the amylytic enzymes for the carbohydrate digestion. And if you have any problem with fat digestion, you take your lipase. Now, most people who have a pancreatic problem will have problems with all three. And these are designed in the to work with. Now, you'll need an iris sclera integrated diagnosis to find out what's going on in your body, so you know exactly what to do to help solve that problem. Any questions? Yes, Jill.
I was just wondering about, I have to get on my toes here to get to the... Oh, okay. Just wondering about lifestyle of the three instructors. Are you eating raw food, or are you eating cooked food and having extra enzymes? If you are on a raw food diet, could you give me an example of what you eat for breakfast, lunch and dinner?
I don't care to talk about that right now, because I used to say I do this and this and this, and everybody else starts doing this and this and this, and they say it doesn't work for them, and they're right. You have to work things out slowly as to what you need to work with. I'll say roughly for the last 3, 4, 5 months, I have been living primarily fruit for breakfast. And then the last 3 months, I've been eating some eggs after I eat my fruit. Okay? But don't do what I do. You have to find out what works for you. Because you're looking at a guy here that had bacon and eggs for breakfast, ham sandwiches for lunch, and pork chops for dinner. 3 times a day, heavy pork eater. And I thought I was a health food nut when I switched to organically grown meat. And then I had my ribeye steaks for breakfast, sometimes 2 of them, my ribeye steaks for lunch, and my great big T-bone steak for dinner. And it was all organically grown, and I thought I was a health nut. I hope you can see the sense of humor in this. And gradually, as I learned, I realized that eating a high-protein diet wasn't the answer. And I switched off gradually down to where I had fish. And I gradually, for about, I would say for maybe 15 years, I had no fish. And gradually, I was very ill for a while with a life-threatening virus. And I had, at that time, I came back and ate a little bit of fish, which I'll eat to this day, a little bit. But mostly I'm fresh and raw vegetarian. And I intend on giving up the fish. Because actually I only had 1 piece in the last little while of fish. But the fresh and raw diet is what I primarily eat. But I want you to work it out for yourself. I used to work out a diet for people, and I found out nobody because of their glitches in their computer, and because of the glitches in my computer, nobody is going to eat the same food. I would say bless it and send it on its way. And then work something out which will work out for you, and it's going to be different for each person because we're all coming from a different vantage point. Okay? Did I answer your question, Jill? Okay. Now, I'll tell you this much. I'm not going to get after you for what you eat if you don't get after me for what I eat. Fair enough? And so we have what they call the Mexican standoff. I'll respect you for eating what you have to eat, and you respect me for eating what I have to eat. Because sometimes I will mix my fruits and vegetables together. And I'll take lots of enzymes and make sure it all digests well, and the purists will say, how can you do that? I said, I did it orally. You know? And I hope all of you just have the same little sense of humor in dealing with these things and not make an issue out of it. It's far more important to worry about what's coming out of your mouth than what you're putting into it. Okay? It's far more important what you think than being so rigid on a diet that you get mad at somebody because they have a piece of cheese. It's far more important to be loving and forgiving in your nature and not worry about what other people are doing, but worry about what you're doing and watch over what you're doing than it is if a person's going to go over to grandma's and have a sugar cookie or have a piece of chocolate cake down here at Shelela. And Corey will be very happy to serve you a nice piece of chocolate cake and a cup of coffee down there with 2 spoonsful of sugar. And somebody will say, how can you drink coffee? Well, I want to tell you something. For those of you who are iridologists, I hope you have an appreciation of this. Doug will remember me when I had my autonomic nerve wreath clear out to the edge of my iris. For the first 50 years of my life, I was constipated. I was one of the worst cases of constipation that I knew. And it was just a real terrible case of continual constipation. The only thing that would work would be coffee, brewed. Not your synthetic coffee, your plastic coffee, but good old coffee beans brewed. And so I had my coffee. I gave it up for 15 years trying to be a real purist. And during that 15 years, I was constipated all the time. I gave up my purist attitude. I had my cup of coffee. I had a good poop, and I felt wonderful. Now, for us old men, don't take away our coffee. Now, I'll have my little coffee once in a while, and I'm just as regular as clockwork. I give it up for a while, and if the constipation comes back, I have a little cup of coffee. But right now, if you check my eyeball as an iridologist, you'll find that over the years, my autonomic nerve wreath has come into a very acceptable, normal positioning. And I really don't have to have the coffee. I simply enjoy it thoroughly. How's that? Is that a glitch? Sure. But listen, if you're going to have what you're going to have and you have a little violet crumble once in a while, I'm not going to shake my head and say, you can't do that. You won't hear me say that. I'll smile at you and look at you as a delightful deviation from the norm. Fair enough?
And to tempt you even further, we have chocolate cake for afternoon tea.
Would you repeat that, please?
To tempt you even further, we have chocolate cake for afternoon tea.
Today? Who ordered that? Oh, beautiful. Just yesterday, I walked by some chocolate cake, and I said, oh, no, I can't have any of that. So I walked by, and now it manifests. Okay, Doug, continue on, sir.
Well, I had some yesterday, too. 2 or 1? 2, actually, I think. Might have been 3, I don't know. What I would say on nutrition is that you can read 100 different books on nutrition, and they'll all contradict each other. And different things work for different people, and like John says, you really have to work it out for yourself. And you know, I've found over the years that I've tried different things that make perfect sense when you read about them, and yet when I try them in my body, some of them work, some of them don't.
I hope you have a sense of humor right here. I can't let this pass. That's when you're constipated. You can't let this pass. And then, as Doug said, you have to work it out for yourself.
Well, I'll leave that to you. At any rate, what I found is that, you know, something that might work perfectly fine for me might not work for somebody else, and something that might work perfectly well for that person might not work for me. So you have to really, you know, try different approaches, you know, different foods to eat and different times of the day to eat them and all that sort of thing, and find something that works for you. I mean, some people, for example, do marvelously well eating one meal a day. Other people who are very hypoglycemic would do horrible if they ate just once a day, and they need to eat 4 or 5 times a day. So for every rule you can come up with, there's going to be exceptions. There's going to be people, you know, like some people do wonderful eating just fruit in the morning. Other people, that's just an absolute disaster for them because they get so hypoglycemic. So, you know, they need to get up and have some oatmeal or something. So you have to really find out what works for you. What I have found down through the years is this, however. As John has said, it's, yes, on the one hand, it's important what you eat, but it's much more important what your attitudes are. And one of the things that I've discovered myself is that as the years have gone by, I've grown increasingly less concerned about my diet. And, you know, like my first few years in the program when I was quite ill and was trying to work through a lot of stuff, I was very, very rigid about the way I was going to eat and very, very determined to do things a certain way, and very upset with myself if I ate something that I didn't think I was supposed to be eating. And one of the things that I've found over the past few years is that by kind of just letting go of a lot of that and not really stressing myself out a whole lot over what I eat, I mean, I figure I probably eat better than some people, worse than others, but ultimately I'm happy eating the way I eat, and I don't make much of an issue of it. I mean, I eat what's available. I do as well as I can. But if I'm going to eat, like if I'm going to have chocolate cake, I'm not going to beat myself up about it. I'm going to enjoy it and probably have seconds. You know,
do you enjoy your fresh and raw pizza?
I absolutely enjoy my fresh and raw pizza. And I think the important thing that I found is just like whatever you eat it with love. I mean, it sounds simple, but it really works. I mean, just whatever you do. Don't do it with a bunch of guilt. Don't do it with any of this other nonsense. Just eat what you eat and be happy with it. And I found that I'm actually a lot healthier now than I was, say, 5 or 6 years ago, when I suppose objectively I was probably eating better then. I mean, if you looked at it in terms of like nutritional rules and all the rest, I was probably eating a lot better 4, 5, 6 years ago than I am now. And yet my health has actually improved, you know, even more in the last couple of years. Not because my diet's gotten any better, but simply because my attitude has. So I think that's something we all want to look at here.
Just so you don't get too excited, there's only one piece per person.
But if any of you are really rigid, fresh and raw types, and you're not going to eat that piece, I'll volunteer.
Would it be appropriate to say, peace be unto you? One piece? Okay. Let's have a little report down here. What's going on down here? Simon?
Right. Well, the STA points are just about finished. There's still some heat on the left-hand side, but the right-hand side's flat. I've gone through quite a bit of calcification on both sides of these points.
Okay, and what's happening on the hard points? Graham, what are you getting, sir?
Well, with my points, the left point has gone down and the right point's still quite hot.
Okay, is it heating up and cooling at all?
No, it's not.
Okay. Trevor, how about you, sir?
Well, my left point is still hot and the right point is numb.
Okay. So the heart firing mechanism is probably pretty well cleared up. It takes just about 5 or 10 minutes for that point, and you just bring a irregular heartbeat right into line. It's beautiful.
Actually, one thing I forgot to tell you, there were 2 or 3 occasions where I've had a vibration going through the right around the back part of the head and the back part of the spine here. It lasts about between 20 and 30 seconds. It's happened 3 times so
You felt
far.
the vibration?
Yeah.
Okay, did you feel the vibration? Talk to us.
Yes, I felt it too.
You felt a vibration
Yes.
going where?
Around my back of my head and around the neck.
That means we've had some cranial shifting going on, which is very unusual for the first point holding. And it means that we're having some real good change going on. Did you have a lot of heat before that? Where things got very warm?
No, I don't think so.
Okay, can you wiggle your toes for us on the right foot now? Can you bend your toes down and up? That's getting some pretty good motion in there. Okay, can you lift your leg up with greater ease now? Bend your knees and so on. How's that feel?
Feels good.
Is it as tight as it was?
It's still stiff, yes.
Okay.
I'll have to exercise it, I think.
Okay, Simon, what's happening over there to you, sir?
To me?
Are you about flat on your point?
Yeah, these points are just about flat.
Okay, you're done then.
Yeah.
Okay. And what's happening, Graham, to yours?
Well, as I said before, the left point's almost done, but I think the right point needs to be on there a bit longer.
Now, you check and see, because we might be going into a cycling mode where it heats up and cools down and comes back and heats up again and cools down again. So you watch for that. And Trevor, what's happening to yours, sir?
There's still heat in the left thumb and numbness in the right thumb.
Okay, let's have Elizabeth and Ruth now check the hair color and see how that central nervous system is healing.
There's much more colour around this way. You know, it's interspersed throughout the white hair, but it's coming up further.
You have more of the dark coming through.
Yep.
How about at the nape of the neck? What's happening there?
It's up higher than it was.
It's what?
It's up higher than it was. The colour's up higher than it was.
It's moving up higher. Now, how's your eyesight coming?
Yeah, it is darker than it was before. It's getting higher.
How's your eyesight coming on the eyes? Where before you're looking through the lenses?
Oh, my eyesight is still the same, I think. I can see things, but I can't see them clearly.
Okay. Okay, look at the front there. Right up there, up front. See if more black hairs are coming through the very front of the hair there.
Yeah, there is more black there.
Still
there wasn't
moving
any
then.
before at all.
So we're still moving slowly.
Yep.
And still moving slowly, and the things just keep getting better and better. Okay. Now, Doug, you did the initial pinching. Do you feel, well, I don't think we need to, do we? Take your right arm, if you would, please, and move that clear back and see how it's working with Simon now. How's the arm working now?
It seems to be about the same.
Take your hand and just very rapidly clench it back and forth. How's that feel now?
Yeah, it's getting a bit better, I think.
Getting better?
Yeah.
Okay. Who wants to take a grip of it now? Now you give her a grip. Squeeze that.
It's a strong grip.
Strong grip. Who else wants to feel that now? Okay.
Yes,
I beg your pardon?
That's a very strong grip.
Very strong grip. How's that grip feel to you now? It's coming good.
Getting a bit more power in my hand anyway.
More power in your hand?
I'll be able to give someone a good jab with it.
Okay. The heat going down a little bit, Graham?
No, not in the right hand thumb, but the left hand one it has.
The right hand is?
Now, The left hand has gone down, but the right hand hasn't.
Okay. Trevor, what's happening on yours? Your left hand is hot?
Yeah, quite the opposite. My left hand is hot.
Okay, I am going to make a quality judgment here. Just the STO is done. I wanted to give support to the heart to make sure that that was taken care of, and we got goal number 1 to get the nerve supply down through the body, goal number 2 to stabilize the heart, which we did on the heart firing mechanism. The heart situation, if you notice in the sclera of the eye, there's just a little blue blotch there, and we're not going to get this all done in one day. Okay? So I'm going to take, from experience, I'm just going to say, let this go for now. And then Trevor, I want you and Graham to help her up, and then we're going to see what that leg is doing. You ready? Everyone, just let loose of the points. We're all done for now. Now, don't expect everything to be happening. The muscles have been not working now for 6 years. Okay? Yeah, but just kind of slowly help her up. Don't let her slide off. You might want to leave those shoes off. Yeah, she needed them before because she couldn't feel the floor. And I want her to feel, Eunice, Elizabeth, you keep that right there. When you get your feet on the floor, I want you to feel the difference.
Yeah, all right.
What do you feel on the floor there? Don't trip over the cord. Okay?
My foot want to lift over a bit.
Say that again, dear.
My foot feels as though it wants to lift a bit.
Your foot feels...
It feels as though it wants...
I can't hear.
It feels as though it wants to get going.
Keep going.
Get going, walking.
Your foot feels like it wants to lift or walk.
Oh, it wants to keep going. Oh, okay. Lift your right leg off the floor now. Now, got that? Okay, now bend your knee and lift it right straight up. Watch this. How's that, everybody? Okay. Now let's walk and see how they're working. Eunice, now that's barefoot. She needed the shoes before for support. How does that feel, Eunice, under your feet?
It feels good.
Can you feel the carpet?
Yes, I can feel the carpet.
And how did the carpet feel before when you had barefoot on the floor?
Oh, it just felt rough. Something to walk on or something.
What's that now?
It just felt like something to drag my foot over.
But no form or feeling in there.
No.
Can you feel the nap under your foot now?
I can feel it now, yeah.
You hear that, folks? Person who had a stroke can't feel the floor under their foot. It's just like walking along on a stump.
Mm.
Do you see this? Now here's where all the nerve supply is back down there. Muscles we have to build back up. Now, Eunice, just turn around and walk back this way again. Then we'll get the shoes on. How's the strength? How's the strength in the legs? Bit weak. We expect that. Now let's get the shoes on and give your foot the strength that it needs and support. Now we'll get the shoes on properly. Now, where the arm is, Eunice, can you lift your arm up, please? Now, you remember how far she could lift up her arm before? Now put it right behind your head, dear. Keep going. There you go. Now that's beautiful. Now that's the first point holding. Now remember, you expect miracles, but there's going to have to be a little physiotherapy, a little bit of exercise, get those muscles straightened out, and there's other work done that we'll talk about in 2 weeks. Okay? Now this will get you started. Now what I'd like you to do is to get a hold of Corey and or Linda and get yourself on a program as soon as possible, so we'll have good results with you.
Oh, yes.
And we'll work on you again in 2 weeks.
Okay.
Okay?
Thank you very much.
Okay, Linda? Will you have time to do that, please? Okay, that's excellent. But you talk to her and work that out and get that underway. You're right here in Brisbane, aren't you?
I'm at Runcorn, near Sunnybank.
How far is that away from here?
Oh, it's a good way away.
Hmm?
It's a good way away from here.
Half hour, no problem. Okay. Did you folks see this now? When I told you that we would restore the nerve supply and circulation back to the body, did this happen? Okay. Now we still have a few little things to work out, don't we? But she has feelings she didn't have before in her fingers and in her toes, and it's going to be there. Move your arm again, dear. How's that feel to you? Say that again, please.
The elbow won't let go, or else I'd be able to put my hand right up.
Okay. Now put it right up again. I feel it'll just keep it right up there. Push it right up there now. You've got it. Help her there a little bit if you would. Back behind your head. Feel that stretching?
Yeah.
Those are muscles I haven't used for quite a while.
Yeah, that's what the trouble is, the muscles. Yeah.
Yeah. Now the thing is get something you can hang on, work that, and
I've got
and
a pulley at home which I can work on.
Yeah. Your friends are going to be very happy. Okay. Now, can you walk without any support now? Remember how hard it was to get up before? Now there you go. Now that is absolutely beautiful to me, and I can feel how beautiful that is to Eunice. And the thing is, Eunice, my advice to you is to use your walker until you get the strength built back up in your leg, okay? Now bring the walker over there, and now that's going to take her everywhere, but she's just going to use that for balance now, not because she needs it. Now move along there, dear, with that, and take a look now at the walking ability she has. How's that feel? That's marvelous. Okay. How about a short break? It's about 4:30 here. Take about a little bit.
Create an even balance of dissolved solids both inside and outside the cells, thus equalizing both internal and external pressures, which we call osmotic equilibrium. Number 10, vitamins are required as coenzymes to work with enzymes in every chemical reaction in every cell of the body. Without minerals extracted from food by enzymes, vitamins would be unable to perform their function. So again, you have to always consider the interdependence of the different nutrients here. The vitamins don't work without the minerals. You don't have the minerals without the enzymes to extract the minerals. And then of course the enzymes don't work as well without the vitamins, and vice versa. So you just keep going around in a circle there, and the bottom line is you have to have all of the different nutrients, because basically none of them perform their job satisfactorily in the absence of any of the other ones. So even if you don't remember all little steps here, the bottom line is pretty simple. You need to cover all your bases here. You need to have your enzymes, your minerals, your vitamins, your amino acids, your essential fatty acids, because if you're missing any of these things, none of the others are going to work properly. So in the long run, just keep it simple.
Up in Genazzano, out of the 90 to 100 people that were there, we had about 20 people that unfortunately slipped through the net, so to speak, because they had never yet experienced the fire of the Kundalini. And we encourage people to have a lot of point holding before they come and find out what they have to do to make the corrections in their body so that they are able to get through and feel that fire of the Kundalini. Exceedingly important. Now, Doug said it. You have to have all of the nutrients in balance, which will vary from one person to another depending upon their individual needs. Some people will be enzyme deficient and will need more enzymes or need more specific enzymes. Some people will need carbohydrates, so they need to go for a good brown rice or something to give carbohydrate to the body because that might be missing. Some people will need more protein because they're protein deficient and they don't have enough protein for the body to go through the necessary activity. We'll go through that in detail tomorrow. Some people will need the minerals, and they're not taking enough minerals to get the results because the body is like a sponge, and if they're mineral deficient, they'll just be sopping up the minerals, and there's not enough to push a person through what we call a nutrient saturation to get into the healing crises properly. The same thing with your essential fatty acids or your vitamins, or shall we go further, they might have to need niacin or the B complex, or their bodies might be deprived of oxygen. And without oxygen, the metabolic processes don't work in the body. And so we have to sometimes look hard to find out exactly what the person is missing in their diet or in their nutrients in order to get a result. It might be a chiropractic adjustment that they might need to get the nerve supply and circulation down before things start working. It might need some cranial work to get the cerebral spinal fluid free to get down through the body. And so some people, unfortunately, never get to the burning, searing pain of the Kundalini until we get into what we call cranial electronics and get the head symmetrical, where the lack of symmetry blocks the free flow of cerebral spinal fluid, which determines the activity of the nerve supply. And so there's a number of factors that all enter in here that we can't, and there's more than what I've just told you. There's a number of things here that you'll find in the blue book when it gets into the program sheet, which we'll discuss tomorrow. Now, this is terribly important for you, because if we're missing one essential part of the puzzle, then the body electronics will not get the results that we anticipate. And sometimes it's just like trying to find a needle in a haystack to find out what's missing here and why isn't the person getting results. Now, eventually we find the problem, but sometimes it's exceedingly difficult to find the problem. So I don't want you to get discouraged if things get rough. They get rough for all of us. And as we're trying to collectively solve a problem to help the person get to the point where they can heal properly. Now, thank God for Eunice. We were able to get some good results on a first point holding, which is quite unusual. But you saw it happen, and this was done not only for Eunice, but also, as I mentioned to Eunice earlier, before we even started, that she was the guinea pig to help out as a teaching tool for the entire class. Okay? So Eunice, I want to thank you once again for your sweetness. Okay? I don't think you're going to complain a bit, are you? It was good. Okay. There are still situations that I'm confronted with that I don't have a solution for, because certain people have certain problems that I don't have an answer for. And then again, where are the tumblers that we need to get in line so that the person will heal properly? Oftentimes it's in the mind. And the person may have a word pattern or some sort of a suppressed trauma which will keep them from healing in a given area. These we'll try to discuss as the next 3 weeks transpire. We won't be able to get everything in one day. I hope you understand that. Okay, Doug, continue on, sir.
Okay, number 11. An enzyme deficiency must be carefully considered as a possible precursor of bodily imbalance and consequent disease symptoms. I mean, again, bottom line, if you're deficient in enzymes, everything in the body is going to work poorly. All of the different physical and mental processes in the body are going to be slowing down and or not working at all, just as a simple result of an enzyme deficiency. Number 12, enzymes are therefore justified as a supplemental dietary substance which need is parallel with mineral, vitamin, and all other supportive therapies. One thing you might want to consider, one way of looking at this, which is pretty simple, you have enzymes in the body that work in a number of different ways. There's many, many different types of enzymes. But if you want to divide them into three fairly simple categories, you have digestive enzymes, which are basically enzymes that are produced within the body and are used within the digestive system. You have metabolic enzymes, which are basically enzymes that are produced within the body and are not used in the digestive system. So basically, of the enzymes that are produced within the body, you got your digestive enzymes and your metabolic enzymes, which is everything else. And then your third category is what you call your food enzymes. And food enzymes come from outside. In other words, they're not produced within your body. They come from either raw food or from food enzyme supplements. So they're what's called an exogenous enzyme, meaning they're from outside the body. But the food enzymes will work and basically fulfill the same purpose that the digestive enzymes would fulfill. They'll help to digest the food. So the simplicity of it is this: the more food enzymes you take in, whether in the form of raw foods, am I going too fast here? Okay. The more food enzymes you take in, whether in the form of raw foods or food enzyme supplements, the less of your body's enzyme potential is going to get used up as digestive enzymes. I mean, ultimately, if you're taking in a large quantity of food enzymes, you're going to use very, very few, if any, of your body's own enzymes to digest the food. So, as you reduce your body's need for digestive enzymes, what you're effectively doing is you're allowing more of your body's enzyme potential to be used for metabolic enzyme production. So ultimately what's going to happen is you're not just going to improve your own digestion by taking in food enzymes. What else are you going to improve? You're going to improve everything, because basically you're going to be liberating that much more of your enzyme potential to function as metabolic enzymes, which is basically every other process in the body besides your digestion, the way we're using the term here. So ultimately, when you're taking the food enzymes in, you're improving far more than just your ability to digest proteins, carbohydrates and fats. You're improving your body's ability right down at a cellular level to do everything else it needs to do to maintain health, to regain health, to regenerate, and all the rest. That's why, for example, in that experiment in the hospital in Florida, where they gave all the patients 2 enzyme capsules a day, per meal, that's why their health improved in all areas. That's why 90% of the symptoms disappeared. Because you weren't simply helping the people to digest their food better, you were giving them that much more enzyme potential to work with, and you were basically allowing the metabolic enzyme potential to increase so that all of the other processes in the body would work more effectively. Does that make sense? So this is why the enzymes are so important here, because if you don't have the enzymes, then all the other things are going to kind of they're only going to take you so far. It's an analogy that I kind of like with regard to enzymes and other essential nutrients is, imagine if you're going to build a house. I mean, you're going to need all the building materials to build that house, whether it's built out of bricks or boards or whatever. You're going to need all these building materials. And, you can get all these building materials delivered to the lot, and you got a great big pile of building materials sitting there, but you still don't have a house. You still have to have something to assemble those building materials in some sort of meaningful fashion. In other words, you need a workforce. So if you look at the body, you can give a person huge quantities of minerals and vitamins and amino acids and essential fatty acids, but if the person doesn't have enough enzymes to get the job done, what you've basically done is dumped a bunch of building materials there, but the workers didn't show up. So you still don't have a house. So that's the basic analogy I think you might want to look at. you can take all the minerals and vitamins and amino acids and essential fatty acids you want, but if you don't have the enzymes, they're not going to do you much good. They're just going to be sitting there in the lot waiting for the workers to show up and put them together in some sort of meaningful fashion. And I think that's as good an analogy as I've heard to explain the role of enzymes in the body. They're what gets the job done. Now, granted, if the workforce shows up and there's no building materials, you don't get much of a house either, so you still need all your minerals and everything else. But the point is you need all of these different factors to get the job done in the body.
I would like to go over the different enzymes and what each one does, because I was back at the table before, and you're going to go back there and you're going to see 5 different bottles, and you're probably going to be wondering which bottle that you should be getting. So we have back there food enzymes. Now, the food enzymes are designed for your digestion. We also have back there the amylase, which digests the carbohydrates, protease, which digests protein, and lipase, which digests the fats. Now, usually we use the lipase in conjunction with flax oil, which we haven't talked to you about yet, but the lipase helps in digesting the oil in the flax oil, so that if your liver is not functioning well, the flax oil will be digested. So we also have back there lymphatic enzymes. Now, John had these specially designed. This is for the mucoprotein. And the mucoprotein, again, is the conjugate of carbohydrate, undigested carbohydrate and protein. So as we go through the iridology, you'll be able to see whether you have these things in your eye. But if you find that you have a lot of mucoprotein, then you might want to get on the lymphatic enzymes and also use the food enzymes for your digestion. When a client comes to us, almost 99% of the time we put them on food enzymes to help, because most people are eating a certain degree of cooked food, so they do need that additional help with the food enzymes. Now, are there any questions on this? No.
There's several things that need to be discussed. We can't get them all done at one time. So Anita, if you go ahead with the minerals.
Okay, minerals. According to Senate document number 264, the official publication, 99% of American people are deficient in minerals. And a marked deficiency in any one of the more important minerals actually results in disease.
That, by the way, was actually as of 1936. So you can pretty well assume that if it was that bad then, it's going to be pretty well be 100% now. Soil certainly hasn't gotten any better in the last 60 years.
Okay, number 2. The body is equipped to chelate only a small amount of some inorganic elements from nature. Therefore, the body requires the minerals to come from plants in a chelated form, that the minerals may be properly assimilated and utilized. The efficiency of each mineral is enhanced by balanced amounts of the others.
It must be made clear that if you go down here to the health food store or to some of your supplement outlets and you get a little mineral supplement, which might be 5 or 6 minerals, I want you to understand that's just a waste of your money. You need to get a broad range of colloidal minerals because the body is capable of absorbing a mineral which is less than 1/2 micron in size, which is known as a colloidal mineral. Now, these do not have to go through the digestive system. Other types of minerals which are inorganic in nature, the body can break down, but the body is incapable of chelating a lot of these minerals that are in a inorganic form. And therefore it's wasted and just passed out through the system and never gets to where it's supposed to go. If you take plants that are grown on certain types of soil, they must be grown on soil that's full of your trace elements in order to get the trace elements in the plant itself. Those the body can absorb because it's in a chelated form that the body can assimilate and utilize. The minerals that are chelated in the laboratory, those particular minerals have to be broken down in the stomach and the intestines, and if the body cannot chelate that, they're wasted, because we have to break those so-called artificially chelated minerals down first before the body can absorb them properly, if it can be absorbed at all. If they're simply an inorganic mineral that's been chelated, the body cannot utilize it. The body can only absorb that which comes from a plant, or that which is in a colloidal form, or just a small handful of minerals, like, for example, like iodine, that the body can chelate a small amount of that and utilize that within the body. So technically, there's a lot of problems about the nutrients that we have. And a lot of people go out here and sell all kinds of vitamins and minerals and supplements and so on, and frankly, it's not worth the powder to blow it up, because it's not going to be utilized by the body, and you're not going to get the changes that you're anticipating by doing it right. And this is a hard struggle to get the right type of nutrients, but we've been doing this for a number of years, and we've been able to sort things through to the point where we know exactly what we need for each human. And I want you to bring out your questions as we look at these carefully, because frankly, some of you make your living off of selling supplementations to people. I want you to consider this. But I want you to appeal to your integrity, to put integrity of product before the profit motive. Because many people will go ahead and sell something where they know it won't do anybody any good, but that's how they make their living. I sometimes find it difficult to justify that. It would be best to keep a position of integrity and then sell those things to people with an honest markup on it to make a living from that, which would be of benefit to the people rather than something that the body cannot assimilate properly or utilize. And there's a lot of things on the market today that the body just simply can't handle, and it's just a waste of money, and it's money down a rat hole for a person. I don't think we need to do that. We need to deal with principles and not, shall we say, personalities based upon the profit motive. Okay?
Okay, number 3. The body must maintain an adequate mineral supply to maintain a balance between internal and external pressures of the body cells, called osmotic equilibrium. This state must be maintained for normal cell function and continued youthful health. Number 4. All nutrients, such as vitamins, proteins, enzymes, amino acids, carbohydrates, fats, sugars, oils, etc., require minerals for activity. All bodily processes depend upon the action of minerals. Number 5. Trace, chelated, or colloidal minerals are more important in nutrition than vitamins. Vitamins can be synthesized by living matter, minerals cannot. Number 6. Vitamins are required for every biochemical activity of the body. Vitamins cannot function unless minerals are present. Number 7. Minerals are the catalyst that make enzyme functions possible. Chelated or colloidal minerals combined with enzymes into an alkaline detoxifying agent which neutralizes the acid metabolic byproducts of the cells and other toxic conditions within the body and prepares them for elimination. Number 8, hormonal secretion of glands is dependent upon mineral stimulation. Okay. Number 9, the acid-alkaline balance of the tissue fluid is controlled by minerals. Number 10, all elements work together as a collective whole. If there is a shortage of just any one mineral, the balance of the entire bodily activity can be thrown awry. A deficiency of one mineral may disrupt the entire chain of life, rendering other nutrients either useless or inefficient. Number 11, the concept brought forth by French scientists concerning the biological transmutation of the elements within the body makes it understandable as to why the body needs the broad range of chelated or colloidal minerals in balance to regain and maintain good health.
Dr. Louis Kervran, a French scientist, has had his work translated into English. This book is called Biological Transmutations. Biological Transmutations by Dr. Louis Kervran, K-E-R-V-R-A-N. If you can get a copy of this material, it's absolutely one of the finest things that was ever written, because the work that he shows is that the body is capable of transmuting one element into another. And he has over 1,000 documented studies showing that in nature, things are not just limited to one atom or one type of an atom, so to speak, but atom can be converted through what we call endothermic or exothermic reactions into other elements. And this is done not only in nature, in plants, but also in the human body. And this is one of the secrets that we have to understand the concept that when the human body goes through a very hot phase, which we call the fire of the Kundalini, that's explained in Book 3 of the Logic and Sequence series. That's also explained in Louis Kervran's book on the concept of biological transmutations. Or an endothermic reaction when the body becomes very, very cold in body electronics, which you'll have to understand as a person goes through a healing crisis. This is one of the finest books in, shall we say, on the cutting edge of modern day chemistry that explains the principles on which body electronics works. So if you can get anything from your books dealer upon Louis Kervran and biological transmutations, that'll be like fine gold, and you'll have several months of very powerful reading to go through. So I think that's important. Go ahead. Go ahead.
Number 12, minerals are therefore justified as a supplementary dietary substance, especially in these days when the mineral content of our fruits and vegetables are destroyed by petrochemicals and synthetic fertilizers.
Thank you. Now, Doug, anything you want to share here at this point?
Well, if you want to look at this in a very, very simple fashion, the main reason that a mineral supplement, I mean, obviously, this establishes the need for minerals in the system in order for the body to work properly. The main reason that a mineral supplement is such an essential thing is really quite simple. The soil has been severely depleted of minerals, particularly in the last few centuries, but it's really, you could look at it in a much bigger perspective. It's something that's been ongoing for tens of thousands of years, but the bottom line right now is our soils are pretty much all severely depleted of the trace elements, and basically we're dependent either directly or indirectly for most of our mineral supply to come from plants, or from, it could be from animals that ate plants or animals that ate plants, but it eventually goes back to the plants. And the simplicity of it is this: the plants aren't going to have the minerals in them if the minerals weren't in the soil in the first place. And bottom line is, most of us here have subsisted almost entirely on food that has come from soil that's mineral deficient. And this is the reason why a mineral supplement is an essential item for really basically for all of us, because if it's not in the soil, it's not going to be in the food that comes from that soil. And this is why we don't see many results in body electronics in most cases when people are not taking some type of good quality mineral supplement, because they very, very quickly deplete whatever meager mineral reserves they might have had. And it takes a lot of minerals for the body to regenerate.
There are known, through scientific research, where they have studied the various shifts of the poles, that there has been, through study of glaciation, there has been at least 25 known glacial, interglacial cycles, each one about 100,000 years in duration. And so what they have found is that there has been a glaciation period of about 90,000 years and about an interglacial period of about 10,000 years. Now, what takes place is that, let's begin now with the interglacial cycle, where the plants have been totally remineralized by the glacial gravel dust that's been ground up by the glaciers and has been spread around the world by wind and by water. And all of a sudden, the plants become very healthy, very luxurious, and remove the excessive amount of carbon dioxide from the Earth's atmosphere and convert that into oxygen, creating a high level of oxygen in the Earth's atmosphere that they have found through glacial cores to be approximately 34 to 38% oxygen. Now, over a period of time, the minerals in the Earth's soil begins to be depleted by very rapid plant growth. And as the minerals become depleted once again, which has happened cycle after cycle after cycle, then the plants begin to die. People begin to use up the natural resources of the forests and so on. And there is a very rapid increase in the carbon dioxide buildup and a rapid decrease in the amount of oxygen in the Earth's atmosphere, to where the life forms